A 55-year-old man with bounding pulses, a wide pulse pressure, a displaced PMI, and a blowing diastolic murmur. Which of the following is the most appropriate additional diagnostic study at this time? The correct answer is transthoracic echocardiography. These findings are classic for aortic regurgitation, and echo confirms the diagnosis while assessing valve anatomy, regurgitation severity, left ventricular size, and systolic function. Why the other choices are wrong. An ankle brachial index evaluates peripheral arterial disease and does not explain the diastolic murmur. Coronary angiography evaluates coronary anatomy and is not the initial test for suspected valvular regurgitation. Pulmonary function testing may assess his smoking-related wheeze, but does not evaluate the dominant cardiac findings. Renal ultrasonography does not evaluate aortic regurgitation, and there is no specific evidence here of obstructive or renovascular kidney disease. High-yield takeaway. Aortic regurgitation gives a wide pulse pressure, bounding pulses, and a diastolic decrescendo murmur. Suspected structural valve disease means get an echo. A 16-year-old with falling grades and frequent cannabis use who asks the physician not to tell his mother. Which of the following is the most appropriate initial physician response? The correct answer is to discuss how cannabis is affecting his functioning and offer to help him tell his mother. This preserves adolescent confidentiality while addressing the substance use and encouraging family support in a collaborative way. Why the other choices are wrong. Simply telling him to decrease cannabis use and return for a urine test is too passive and does not explore the functional problem. Giving only a treatment program phone number bypasses the therapeutic conversation. Lecturing him that cannabis is bad for his brain is confrontational and less likely to promote behavior change. Saying the discussion will remain entirely between physician and patient misses the opportunity to encourage appropriate parental involvement. High-yield takeaway. With a competent adolescent and no imminent safety threat, preserve confidentiality, address the problem non-judgmentally, and encourage voluntary involvement of a trusted adult. A 71-year-old woman with severe COPD, a DNR order that says nothing about intubation, and intact decision-making capacity who now declines reintubation. Which of the following is the most appropriate next step in management? The correct answer is to discuss her options directly with her and clarify her current goals. A DNR order applies to cardiopulmonary resuscitation after arrest and does not automatically determine preferences about intubation or other treatments. Why the other choices are wrong. Telling her that another refusal automatically means comfort care creates a false either-or choice. Contacting her daughter is unnecessary while the patient herself has capacity. Reintubating her against her expressed wishes violates autonomy. A psychiatric capacity evaluation is not indicated merely because a capable patient makes a high-stakes decision. High-yield takeaway. DNR means do not resuscitate, not do not treat. Capacity present means the patient decides. Recurrent portal systemic encephalopathy falls from 35% with one treatment to 15% with another. According to the results in the abstract, approximately how many patients must be treated with EPCS rather than EST to prevent one case of recurrent portal systemic encephalopathy? The correct answer is 5. The absolute risk reduction is 35% minus 15%, or 20%. 1 divided by 0.20 equals 5. Why the other choices are wrong. 1 would require a 100% absolute risk reduction. 3 corresponds to an absolute risk reduction of about 33%. 10 corresponds to 10%. 16 corresponds to about 6%. None matches the observed 20% absolute reduction. High yield takeaway. Number needed to treat equals 1 divided by absolute risk reduction. Do not use relative risk reduction for this calculation. Identify what most limits the generalizability of a randomized trial comparing emergency portacaval shunt with endoscopic therapy for bleeding esophageal varices. Which of the following most strongly limits the generalizability of this study's findings? The correct answer is that the portacaval shunt is available mainly at specialty centers. A technically demanding intervention performed in highly specialized settings may not reproduce the same outcomes in ordinary community settings, which limits external validity. Why the other choices are wrong. Concealed allocation improves internal validity rather than limiting generalizability. The follow-up was long, not too short. Lack of patient blinding in a surgical trial can affect bias, but is not the main external validity problem. Randomization is specifically intended to distribute measured and unmeasured confounders between groups. High-yield takeaway. Internal validity asks whether the study result is trustworthy. External validity asks whether the result applies to your patients and setting. Identify which conclusion is best supported by a randomized trial table comparing emergency portacaval shunt with endoscopic sclerotherapy. Which of the following conclusions is most appropriate based on the results presented in the table? The correct answer is that emergency portacaval shunt decreases hospital readmissions for variceal bleeding requiring transfusion. The reported mean readmissions were dramatically lower, and the difference was statistically significant. Why the other choices are wrong. Saying the confidence interval for the survival difference includes 0 contradicts the reported statistically significant survival result. Claiming median survival after the shunt is significantly lower in Child-Pugh Class C than Class B is not a valid between-strata inference from the displayed data unless that direct comparison was tested. Saying randomization was ineffective is unsupported. The study used randomization and concealed allocation specifically to reduce bias. High-yield takeaway. Answer from the data actually shown. Do not infer a statistical comparison that the study did not directly test. A 4-year-old with fatigue, weight loss, hyponatremia, normal potassium, and repeated recent courses of oral prednisone for asthma. Which of the following is the most likely underlying cause of this patient's current condition? The correct answer is decreased ACTH production causing secondary adrenal insufficiency. Exogenous glucocorticoids suppress CRH and ACTH, lowering endogenous cortisol production. Aldosterone is largely preserved because it is controlled mainly by the renin-angiotensin-aldosterone system, explaining the normal potassium. Why the other choices are wrong. 21-hydroxylase deficiency causes primary adrenal steroid deficiency and commonly produces hyperkalemia in severe forms. Decreased ADH causes diabetes insipidus with dilute urine and hypernatremia, not hyponatremia. Increased aldosterone causes hypertension and hypokalemia. Increased insulin would primarily cause hypoglycemia and does not explain this endocrine pattern. High-yield takeaway. Secondary adrenal insufficiency gives low cortisol with relatively preserved aldosterone. Normal potassium helps distinguish it from primary adrenal failure. A 64-year-old woman with sudden dyspnea, tachycardia, severe hypoxemia, and recent surgery despite relatively clear lungs. Which of the following is the most likely diagnosis? The correct answer is pulmonary embolism. Recent surgery is a major venous thromboembolism risk factor, and acute hypoxemia with tachycardia and no convincing pulmonary infiltrate strongly supports PE. Why the other choices are wrong. A COPE exacerbation usually features worsening wheeze, cough, or sputum and would not be explained by the recent postoperative risk. Heart failure usually produces congestion, rales, edema, or radiographic pulmonary edema. Pneumonia generally causes fever, respiratory symptoms, and an infiltrate. Pneumothorax usually causes unilateral decreased breath sounds and characteristic imaging findings. High-yield takeaway. Sudden, unexplained postoperative hypoxemia and tachycardia should make you think pulmonary embolism. Two influenza screening tests are compared using receiver operating characteristic curves. Based on these data, which of the following is the most appropriate conclusion to draw about Test A compared with Test B? The correct answer is that Test A is more accurate than Test B in the low false positive rate range because its ROC curve lies higher in that clinically relevant region. Why the other choices are wrong. The statements claiming Test A is superior in the high false positive rate or high sensitivity range are not supported by where the curves separate. The statement that Test B is more accurate in the low sensitivity range reverses the relationship shown on the graph. High-yield takeaway. An ROC curve plots sensitivity against 1 minus specificity. At a given false positive rate, the curve with the higher sensitivity performs better. The ideal curve hugs the upper left corner. A 19-year-old groundskeeper in western North Carolina with fever, severe headache, thrombocytopenia, and a petechial rash involving the palms and soles. Which of the following is the most likely source of this patient's illness? The correct answer is a tick bite. This is Rocky Mountain spotted fever from Rickettsia rickettsii, transmitted by ticks. Why the other choices are wrong. Inhaling contaminated droplets suggests respiratory pathogens, not this vasculitic rash. Golf course insecticide exposure does not cause the characteristic febrile palms and soles rash. Kissing suggests infections spread by saliva, such as Epstein-Barr virus. Mosquito bites transmit diseases such as West Nile virus, but not Rocky Mountain spotted fever. High-yield takeaway. Fever, headache, thrombocytopenia, and a rash involving palms and soles equals think RMSF. Treat suspected disease promptly with doxycycline rather than waiting for confirmatory testing. Identify which maternal factor most increases the future infant's risk of sudden infant death syndrome in a pregnant 19-year-old who continues to smoke. Which of the following factors in this patient's history places her infant at greatest risk for sudden infant death syndrome, SIDS? The correct answer is maternal smoking. Prenatal and postnatal tobacco smoke exposure are major modifiable risk factors for SIDS. Why the other choices are wrong. Unemployment may correlate with social risk, but is not the key direct modifiable factor here. A remote history of cocaine use with negative screening during pregnancy is less important than ongoing smoking. Lack of breastfeeding is associated with higher SIDS risk, but ongoing maternal tobacco exposure is the stronger factor among these choices. High-yield takeaway. Reduce SIDS risk with supine sleep, a firm, uncluttered sleep surface, and no smoke exposure. Think back to sleep, bare crib, no smoke. Explain why a man with left lower lobe pneumonia becomes less hypoxemic when he lies with the healthy right lung down. Which of the following best explains this improvement? The correct answer is a positional decrease in the alveolar arterial oxygen gradient. Gravity sends more perfusion to the dependent lung, so placing the better ventilated lung down improves ventilation perfusion matching. Why the other choices are wrong. Pulmonary emboli do not appear and disappear based on body position. Positional limitation of left ventricular filling does not explain the focal pneumonia and oxygenation change. Diaphragm movement is not the main mechanism of rapid improvement. Pleural fluid may redistribute with position, but the amount of fluid does not acutely increase or decrease. High-yield takeaway. In significant unilateral lung disease, good lung down generally improves oxygenation. A 12-year-old with a seizure disorder who forgot her carbamazepine while visiting an aunt who is not her legal guardian. Which of the following is the most appropriate next step? The correct answer is to attempt to contact the mother for permission before giving medication or writing a prescription. The child is stable, so this is not an emergency exception to parental consent. Why the other choices are wrong. Giving both the dose and prescription without consent is inappropriate in a non-emergency. Giving only the dose still constitutes treatment requiring consent. The aunt cannot simply sign as guardian when she has no legal authority. Writing only a prescription also constitutes medical treatment and still requires appropriate consent. High-yield takeaway. For a minor, emergency means stabilize first. Non-emergency means obtain consent from the legal decision-maker unless a recognized exception applies. A 50-year-old woman with activity-related knee and hand pain, brief morning stiffness, and bony enlargement of the DIP and PIP joints. X-rays of the knees are most likely to show which of the following. The correct answer is subchondral sclerosis with asymmetric joint space narrowing, classic radiographic osteoarthritis. Why the other choices are wrong. Bone demineralization and erosions point toward inflammatory arthritis such as rheumatoid arthritis. Large cystic erosions and marked soft tissue swelling suggest crystal or erosive inflammatory disease. Soft tissue swelling without cartilage or bone destruction is more compatible with early inflammatory arthritis. A normal X-ray would be unlikely with clinically established bony osteoarthritis. High-yield takeaway. Osteoarthritis imaging is joint space loss, osteophytes, subchondral sclerosis, and subchondral cysts. A 54-year-old woman fixated on having Barrett esophagus despite inconsistent adherence to conservative GERD treatment. Which of the following is the most appropriate next step in management? The correct answer is to ask her to describe her goals and expectations of treatment. This clarifies what she is seeking, addresses the underlying concern, and preserves a collaborative physician-patient relationship. Why the other choices are wrong. Immediately offering a specialist can reinforce procedure seeking before the concern is explored. Asking only why she thinks she has Barrett esophagus may focus the conversation on her self-diagnosis rather than her goals. Challenging her lack of diet and exercise adherence can sound accusatory. Asking how she feels about an unresolved condition may be useful later, but it is less direct than first clarifying what she hopes treatment will accomplish. High-yield takeaway. In communication scenarios, explore the patient's agenda and expectations before reassuring, arguing, or ordering tests. Generalized itching without rash that began after a man with a kidney stone started oxycodone. Which of the following is the most likely cause of this patient's pruritus? The correct answer is oxycodone therapy. Opioids commonly cause pruritus through central opioid mechanisms and, with some agents, mast cell histamine release. This does not automatically mean a true IgE-mediated allergy. Why the other choices are wrong. A psoriasis flare should produce characteristic plaques rather than isolated excoriations. Common bile duct obstruction can cause pruritus, but would usually be accompanied by cholestatic findings such as jaundice or dark urine. Tamsulosin more commonly causes dizziness, orthostasis, or ejaculatory effects. Ureteral obstruction explains renal colic and hematuria, not generalized pruritus. High-yield takeaway. Medication side effect is not the same as drug allergy. Opioid itching without anaphylactic features is a classic example. A 50-year-old woman with postprandial symptoms, mild scleral icterus, and a palpable epigastric mass suspicious for pancreatic malignancy. Which of the following is the most appropriate initial diagnostic study? The correct answer is CT of the abdomen. Cross-sectional pancreatic imaging is the appropriate initial study to define a pancreatic mass, assess ductal dilation, vascular involvement, and metastatic disease. Why the other choices are wrong. Amylase and lipase are useful for acute pancreatitis, not for defining a suspected pancreatic tumor. ERCP is invasive and is mainly used for therapeutic biliary intervention rather than as the initial mass imaging test. A HIDA scan evaluates gallbladder function and cystic duct obstruction. An upper GI barium study evaluates luminal upper gastrointestinal pathology, not the pancreas. High-yield takeaway. Suspected pancreatic mass means obtain dedicated cross-sectional imaging first. Endoscopic ultrasound is often used later for tissue acquisition. Identify which pathology is expected in an older man with acute mesenteric ischemia and infarcted bowel. Which of the following histopathologic changes will most likely be identified in the resected colon? The correct answer is coagulative necrosis involving the mucosa and submucosa. Ischemic infarction produces coagulative necrosis in most tissues outside the central nervous system. Why the other choices are wrong. Caseating granulomas suggest tuberculosis and some chronic granulomatous diseases. Neutrophilic mucosal inflammation with congestion is more consistent with acute inflammatory or infectious colitis. Mucopurulent exudates and crypt injury point toward colitis rather than vascular infarction. Transmural chronic inflammation with deep ulceration is characteristic of Crohn's disease. High-yield takeaway. Ischemia causes coagulative necrosis almost everywhere. The brain is the famous exception, where infarction causes liquefactive necrosis. Determine how to reduce repeated discrepancies between prescribed oxygen and the amount actually delivered in the hospital. In addition to reviewing the hospital's protocol for oxygen delivery, instituting which of the following measures would most likely decrease discrepancies in oxygen delivery without creating additional risks. The correct answer is to create a standardized oxygen order set containing the starting dose, titration parameters, and target. The failure is a system design problem, so the strongest intervention standardizes the process. Why the other choices are wrong. Education alone is weaker than redesigning the workflow. Preventing nurses from titrating oxygen may delay appropriate care. Requiring verbal orders and later signatures preserves an unreliable communication pathway. Requiring a physician phone call for every adjustment creates delays and unnecessary workload. High-yield takeaway. Recurrent errors across multiple clinicians usually call for a system-level fix, not reminders or blame. Identify which factor best predicts mother-to-child HIV transmission in a woman considering future pregnancy. Which of the following is the most accurate statement? The correct answer is maternal HIV viral load. The degree of maternal viremia is the strongest predictor of perinatal transmission risk, and effective antiretroviral therapy with viral suppression markedly lowers that risk. Why the other choices are wrong. Newborns are not the subgroup with the fastest population-level increase in HIV infection. Intrapartum transmission can account for a substantial proportion of perinatal transmission without effective prevention, so the stated absolute claim is not the key principle. Time from initial maternal infection is much less predictive than viral load. Route of delivery can affect transmission risk in patients with significant viremia, so saying delivery route never matters is false. High-yield takeaway. For perinatal HIV transmission, viral load is king. A 24-year-old woman with recurrent irritability, insomnia, headache, fatigue, and overeating that occur for a few days at a time and then resolve. At this time, specific additional history should be obtained regarding which of the following. The correct answer is to ask about the timing of symptoms in relation to the menstrual cycle. A cyclic late luteal pattern that resolves around the onset of menses suggests premenstrual dysphoric disorder. Why the other choices are wrong. Carbohydrate intake may affect appetite, but does not establish the cyclic psychiatric diagnosis. Coital frequency is not central. Exercise frequency can influence mood, but does not explain the periodic pattern. Trauma history is relevant for PTSD, which requires a qualifying traumatic exposure and a different symptom cluster. General stress level is nonspecific and does not establish menstrual cyclicity. High-yield takeaway. Suspected PMDD requires establishing a reproducible relationship between symptoms and the menstrual cycle, ideally with prospective symptom tracking. Determine whether an 18-year-old high-performing student without ADHD should receive a stimulant-like medication to study longer and lose weight. Based on the advertisement, which of the following is the most appropriate rationale for this decision? The correct answer is that the medication is not indicated for this patient. A desire for cognitive enhancement or appetite suppression does not create a medical indication for a controlled stimulant. Why the other choices are wrong. Concomitant stimulant use may be relevant to safety, but it is not the fundamental reason to refuse an unnecessary prescription. A mid-systolic click does not by itself establish a contraindicating cardiac condition. Possible diversion is speculative and is not the primary reason. Whether the drug produces weight loss is irrelevant because weight loss is not the indication being treated here. High-yield takeaway. Patient preference does not create a medical indication. Identify what the major advantage of a long-acting ADHD medication is over another extended-release stimulant based on the advertisement. Based on the advertisement, which of the following is the greatest advantage of Esapro XL over methylphenidate XL? The correct answer is increased duration of action. The comparative information supports longer coverage, which can reduce the need for repeat dosing during the day. Why the other choices are wrong. The advertisement does not establish less sleep disruption, lower dependence potential, fewer gastrointestinal adverse effects, superior academic performance, or a larger safety database. Those claims would require supporting comparative evidence. High-yield takeaway. Read pharmaceutical advertisements literally. Do not infer benefits that are not demonstrated by the presented data. A 63-year-old man with a 10-minute episode of painless monocular blindness that resolved completely. Which of the following is the most appropriate diagnostic study at this time? The correct answer is carotid ultrasonography. Transient monocular vision loss, or amaurosis fugax, is usually transient retinal ischemia from embolic disease in the ipsilateral carotid circulation. Why the other choices are wrong. Fluorescein angiography is used for retinal vascular and choroidal pathology, but does not address the likely embolic source. Intraocular pressure testing evaluates glaucoma, which does not cause this classic painless transient ischemic episode. Transesophageal echocardiography may evaluate a cardiac embolic source, but carotid disease is the higher yield initial source in this presentation. No further evaluation is unsafe because amaurosis fugax is a transient ischemic attack equivalent requiring vascular evaluation. High-yield takeaway. One eye temporarily goes dark. Check the carotid. Identify which factor most predisposes a hospitalized woman with stage 3 chronic kidney disease to acute kidney injury after contrast exposure and severe hypertension. Which of the following factors in this patient's history most increased her risk for developing her current complication? The correct answer is pre-existing chronic kidney disease. Reduced baseline renal reserve is a major susceptibility factor for acute kidney injury from additional hemodynamic or nephrotoxic insults. Why the other choices are wrong. Bladder catheterization actually helps assess post-renal retention and does not create this intrinsic susceptibility. Uncontrolled hypertension can contribute to chronic renal injury, but is less important than established CKD as the immediate AKI risk factor. Lisinopril can worsen renal function in certain hemodynamic settings, but does not outweigh the baseline CKD risk here. Volume depletion would be important if present, but the vignette does not establish it. High-yield takeaway. CKD means reduced renal reserve, so smaller insults can produce a larger creatinine rise. Determine how to test a 28-year-old man with dysuria and watery urethral discharge for sexually transmitted urethritis. Which of the following is the most appropriate diagnostic study at this time? The correct answer is a nucleic acid amplification test for Neisseria gonorrhea and Chlamydia trachomatis. NAAT is the preferred sensitive diagnostic method for these common causes of urethritis. Why the other choices are wrong. Gram stain around prostatic massage is not the preferred diagnostic strategy for uncomplicated gonococcal or chlamydial urethritis. Routine urinalysis may show inflammation but does not identify the organism. Standard urine culture does not reliably diagnose chlamydia and is not the preferred test for this syndrome. Deferring testing because the reported sexual history seems low risk can miss infection. Diagnostic decisions should follow the clinical syndrome. High-yield takeaway. Urethritis equals NAAT for gonorrhea and chlamydia. A 44-year-old woman with newly, much heavier, and prolonged regular menstrual bleeding. Which of the following is the most appropriate diagnostic study at this time? The correct answer is endometrial biopsy. Significant abnormal uterine bleeding in this age group requires evaluation for endometrial hyperplasia or malignancy rather than assuming a benign structural cause. Why the other choices are wrong. Colposcopy evaluates cervical epithelial abnormalities, not the endometrium. FSH and LH are not useful for explaining heavy regular bleeding. Prolactin testing is more useful in amenorrhea or galactorrhea. Hysteroscopy can visualize the uterine cavity but is more invasive and is not the initial tissue sampling step when biopsy is appropriate. High-yield takeaway. Abnormal uterine bleeding requires endometrial sampling when age or risk profile raises concern for hyperplasia. A 2-month-old infant with jaundice, pale stools, and conjugated hyperbilirubinemia from biliary atresia. Which of the following changes is most likely occurring in this patient's liver at this time? The correct answer is bile ductular proliferation. Extrahepatic biliary obstruction causes reactive ductular proliferation with portal inflammation and progressive portal fibrosis. Why the other choices are wrong. Centrilobular necrosis is typical of ischemic or certain toxic hepatic injuries. Increased glycogen stores suggest glycogen storage disease. Intranuclear hepatocyte inclusions suggest viral infection such as CMV or HSV. Macrovesicular steatosis is characteristic of fatty liver and some metabolic disorders, not biliary obstruction. High-yield takeaway. An infant with pale stools plus direct hyperbilirubinemia has cholestasis until proven otherwise. Biliary atresia is a time-sensitive diagnosis. An older man with acute ataxia, dysphagia, crossed cranial nerve and motor findings, and asks which vascular circulation is involved. This patient's symptoms are most consistent with injury to the brain in the area supplied by which of the following cerebral arteries? The correct answer is the vertebro-basilar circulation. Brainstem ischemia classically produces cranial nerve findings on one side, with motor or sensory deficits on the opposite side, along with dysphagia and ataxia. Why the other choices are wrong. Anterior cerebral artery infarction mainly affects the contralateral leg and medial frontal lobe functions. Internal carotid disease produces anterior circulation syndromes rather than a classic brainstem pattern. Middle cerebral artery infarction causes face and arm predominant deficits and possibly aphasia or neglect. Posterior cerebral artery infarction classically causes visual field deficits. High-yield takeaway. Crossed neurologic findings, plus dysphagia or ataxia, localized to the brainstem and posterior circulation. A newborn with trisomy 18, severe congenital anomalies, feeding dependence, and recurrent apnea. Which of the following is the most appropriate next step? The correct answer in this vignette is referral to home hospice care. The key concept is proportionality of treatment and comfort-focused care when the expected benefit of burdensome interventions is extremely limited. Why the other choices are wrong. A sleep study does not change the underlying life-limiting condition or management goal. Head CT is not indicated merely to further characterize an already established syndrome. EEG is not the priority without evidence that seizures are driving the episodes. Cardiology referral may identify structural disease, but the STEM is asking for the most appropriate global plan rather than another specialty workup. High-yield takeaway. Goals of care decisions are individualized and based on prognosis, burdens, benefits, and family values. A diagnosis alone never automatically mandates hospice. A man with an inferior STEMI who becomes profoundly hypotensive after nitroglycerin. Which of the following is the most likely cause of this patient's symptoms? The correct answer is right ventricular infarction. The right ventricle is highly preload dependent, and nitroglycerin reduces venous return, which can cause a dramatic fall in cardiac output when the RV is infarcted. Why the other choices are wrong. Acute mitral regurgitation usually causes a new systolic murmur and pulmonary edema. Tamponade can cause hypotension and JVD, but does not explain the inferior STEMI and nitrate sensitivity. Pulmonary embolism causes dyspnea and hypoxemia rather than a territorial inferior STEMI pattern. Vasovagal syncope typically includes bradycardia and does not explain the infarction. High-yield takeaway. Inferior MI plus hypotension, clear lungs, and nitrate sensitivity equals think right ventricular infarction. RV means requires volume. Determine whether a treatment effect in rheumatoid arthritis is statistically significant and clinically meaningful when the p-value is 0.02 and the reduction in inflamed joints is substantial. Which of the following is the most appropriate conclusion to draw regarding the clinical and statistical significance of this study? The correct answer is yes to both. A p-value below 0.05 meets the conventional statistical significance threshold, and the magnitude of improvement is large enough to matter clinically. Why the other choices are wrong. Answering no to statistical significance ignores the p-value. Answering no to clinical significance ignores the meaningful reduction in active joints. The option saying neither is significant is therefore inconsistent with both the statistics and the clinical effect. High-yield takeaway. Statistical significance asks whether the effect is unlikely to be due to chance. Clinical significance asks whether the effect is important to the patient. Determine how to perform medication reconciliation in a cognitively impaired woman who cannot remember her medicines and whose usual caregiver is unavailable. Which of the following is the most appropriate initial approach to managing the patient's medications? The correct answer is to contact her pharmacy for the current medication record. Pharmacy dispensing data provide a practical, objective starting point for reconstructing her regimen. Why the other choices are wrong. Asking police to enter a home is disproportionate and may still yield outdated pill bottles. Merely observing her while trying to reach a clinician delays needed medication verification. Ordering medicines from a 1-year-old emergency record risks major errors because the regimen may have changed. Serum drug levels apply only to certain medications and cannot reconstruct a complete medication list. High-yield takeaway. When the patient cannot provide a medication history, verify with the pharmacy, medication bottles, prior records, and caregivers rather than guessing. Determine how researchers should respond when African American patients are underrepresented because potential participants are reluctant to enroll in a minimal risk study. Which of the following is the best course of action to take? The correct answer is to convene a representative focus group to identify the reasons for reluctance and barriers to enrollment. Community engagement addresses the actual concern while respecting autonomy. Why the other choices are wrong. Waiving informed consent simply to improve enrollment violates ethical protections. Recruiting mostly white participants accepts the disparity rather than addressing it. Calling the disparity unavoidable ignores a remediable recruitment problem. Requiring participation as a condition of clinical care is coercive and violates voluntary consent. High-yield takeaway. When a group is underrepresented, engage the affected community and identify barriers. Do not weaken consent or coerce participation. A man with cirrhosis from hemochromatosis who develops septic shock and rapidly appearing hemorrhagic bullae after travel with likely marine exposure. Which of the following microorganisms is the most likely causal agent of this patient's condition? The correct answer is Vibrio vulnificus. Severe Vibrio infection is strongly associated with chronic liver disease and iron overload and can cause fulminant sepsis and hemorrhagic skin lesions after raw shellfish or seawater exposure. Why the other choices are wrong. Enterobacter is primarily associated with healthcare and opportunistic infections rather than marine exposure with bullae. Enterococcus commonly causes urinary infection, bacteremia, or endocarditis, not this classic syndrome. Mycobacterium marinum causes a more indolent, nodular, or granulomatous skin infection after aquatic exposure rather than fulminant septic shock. High-yield takeaway. Raw oysters or seawater plus liver disease plus hemorrhagic bullae equals Vibrio vulnificus. Severe disease requires immediate antibiotics and urgent surgical evaluation if necrotizing infection is suspected. Identify what test should follow a fasting glucose of 126 milligrams per deciliter in an asymptomatic 55-year-old with obesity and no prior diabetes diagnosis. Determination of which of the following is the most appropriate next step in evaluation. The correct answer is hemoglobin A1C. A fasting glucose of 126 is already in the diabetes diagnostic range, but in the absence of unequivocal symptomatic hyperglycemia, the diagnosis should be confirmed by repeat abnormal testing. An A1C is an appropriate confirmatory test here. Why the other choices are wrong. Arterial blood gases do not diagnose diabetes. A 3-hour glucose tolerance test is not the standard adult diagnostic test. The standard oral glucose tolerance diagnostic value is based on the 2-hour level after a 75-gram glucose load. Serum cortisol does not evaluate this hyperglycemia pattern. Fructosamine reflects shorter-term glycemia, but is not a standard first-line diagnostic test for diabetes. High-yield takeaway. Remember 6.5, 126, and 200. A1C 6.5%, fasting glucose 126, or 2-hour glucose 200 are diabetes range thresholds. A 3-month-old infant in winter with a viral prodrome, copious secretions, wheezing, diffuse respiratory distress, and hypoxemia. Which of the following is the most likely cause of this infant's illness? The correct answer is respiratory syncytial virus. RSV is the classic cause of bronchiolitis in young infants and produces small airway edema, mucus, wheezing, and increased work of breathing. Why the other choices are wrong. Haemophilus influenzae is associated with bacterial pneumonia or epiglottitis rather than classic diffuse bronchiolitis. Herpes infection in infants usually raises concern for vesicular disease, encephalitis, or disseminated infection. Mycoplasma pneumoniae mainly affects older children and adolescents. Streptococcus pneumoniae more typically causes focal bacterial pneumonia with consolidation. High-yield takeaway. Bronchiolitis in an infant is usually managed supportively with suction, hydration, and oxygen when needed. Routine bronchodilators, steroids, and antibiotics are not standard treatment. Identify which finding is most important before prosthetic rehabilitation in a 67-year-old man who has just undergone a left transfemoral amputation and has severe peripheral vascular disease and diabetes. Which of the following findings on further physical examination is most likely to inhibit this patient's long-term ability to ambulate with a prosthesis? The correct answer is the black eschar on the right heel. His remaining limb will carry the mechanical burden of transfers and future ambulation, and a pressure or ischemic injury on that limb could threaten his independence and lead to another amputation. Why the other choices are wrong. A 5-degree hip flexion contracture should be addressed during rehabilitation, but is less immediately threatening than tissue necrosis in the intact limb. An irregular pulse is expected with known atrial fibrillation and is already being treated. Loss of great toe proprioception reflects diabetic neuropathy but is less urgent than an active heel eschar. High-yield takeaway. After amputation, aggressively protect the contralateral limb. Skin breakdown or ischemia there can determine whether the patient will ever ambulate with a prosthesis. A 21-year-old ballet dancer with low body weight, intense endurance exercise, bradycardia, and 8 months of amenorrhea. Which of the following is the most likely cause of this patient's amenorrhea? The correct answer is hypothalamic hypogonadism. Low energy availability and excessive exercise suppress pulsatile GnRH secretion, lowering LH and FSH and causing hypoestrogenic amenorrhea. Why the other choices are wrong. Addison disease causes adrenal insufficiency with findings such as hypotension, hyperpigmentation, hyponatremia, and often hyperkalemia rather than isolated exercise-associated amenorrhea. Partial hypopituitarism would usually involve additional pituitary hormone abnormalities. PCOS generally features hyperandrogenism and often overweight or insulin resistance, not this low-energy phenotype. Premature ovarian failure produces hypergonadotropic hypogonadism with elevated FSH rather than hypothalamic suppression. High-yield takeaway. Low weight plus intense exercise plus amenorrhea equals functional hypothalamic amenorrhea. Think low energy shuts down GnRH. Identify which organism causes watery diarrhea with numerous 6 micrometer acid-fast oocysts in a teenager with recurrent infections. Which of the following is the most likely causal agent of this patient's condition? The correct answer is Cryptosporidium parvum. Cryptosporidium causes watery diarrhea and is identified by small acid-fast oocysts in stool. Why the other choices are wrong. Entamoeba histolytica causes invasive dysentery and flask-shaped colonic ulcers, not small acid-fast oocysts. Norovirus causes acute vomiting and watery diarrhea, but is not identified by acid-fast oocysts. Salmonella typhi causes systemic enteric fever. Shigella commonly causes inflammatory or bloody diarrhea. High-yield takeaway. Watery diarrhea plus acid-fast oocysts equals Cryptosporidium. Determine how to screen for an underlying immune deficiency in a teenager with recurrent sinopulmonary infections and Cryptosporidium infection. In determining whether this patient has an immune deficiency, which of the following is the most appropriate diagnostic study to obtain at this time? The correct answer is quantitative serum immunoglobulin concentrations. Recurrent bacterial respiratory infections make a humoral immune deficiency a major concern, so IgG, IgA, and IgM are an appropriate initial screen. Why the other choices are wrong. A CD4 count is useful when a T-cell deficiency, such as HIV, is suspected, but does not best fit recurrent routine sinopulmonary bacterial infections. A CD8 count is even less useful as the initial screen. Complement testing is most useful for characteristic recurrent infections such as Neisseria with terminal complement deficiency. An interferon gamma assay is used in tuberculosis evaluation and does not screen broadly for antibody deficiency. High-yield takeaway. Recurrent bacterial sinopulmonary infections suggest humoral immunity problems. Start by measuring immunoglobulins. Identify which screening test should be chosen when the patient is especially concerned about avoiding false negative results. Based on these data, which of the following screening tests is the most appropriate choice for this patient? The correct answer is the test with the highest sensitivity, represented by curve B in the figure. High sensitivity minimizes false negatives. Why the other choices are wrong? The other curves trade away sensitivity for greater specificity, or have inferior performance at the relevant cutoff. Saying the answer cannot be determined is incorrect, because the graph provides the sensitivity and false positive behavior needed to compare tests. High-yield takeaway. SNN out. A highly sensitive test, when negative, helps rule out disease. SPPIN is the companion mnemonic for specificity. Determine how to make a Phase 3 trial of a diabetes prevention medication as efficient as possible. Which of the following inclusion criteria should be selected to design the most efficient study? The correct answer is to enroll adults aged 45 or older with hyperlipidemia and central obesity. These patients do not yet have diabetes, but have a high enough baseline risk that enough incident diabetes cases should occur to detect a preventive effect efficiently. Why the other choices are wrong? Lean young smokers are not a particularly enriched population for developing type 2 diabetes. Enrolling healthy adults with no major risk factors lowers the event rate and requires a much larger study. A hemoglobin A1C of 6.5% or greater is already in the diabetes range, so those participants would not be appropriate for a prevention of diabetes trial. High-yield takeaway. Prevention trials are most efficient when you enroll people at high future risk who do not already have the disease. Explain why celecoxib raises cardiovascular concern in a 65-year-old man with prior myocardial infarction. The concerns with adding celecoxib to this patient's medication regimen are related to inhibition of which of the following processes? The correct answer is inhibition of COX2 with decreased prostacyclin, or PGI2, production. Endothelial prostacyclin normally promotes vasodilation and inhibits platelet aggregation, while platelet thromboxane production through COX1 remains relatively preserved, shifting the balance toward thrombosis. Why the other choices are wrong? Non-selective inhibition of both COX1 and COX2 does not describe celecoxib's selective mechanism. COX1 is not the major source of endothelial prostacyclin targeted by celecoxib. Decreasing COX1-mediated thromboxane would reduce platelet aggregation rather than explain the prothrombotic concern. COX2 does not primarily generate platelet thromboxane A2. High-yield takeaway. Selective COX2 inhibition lowers prostacyclin while sparing platelet thromboxane, which can tilt the system toward clotting. A long-term smoker with right arm weakness plus right-sided ptosis and meiosis. Which of the following is the most likely diagnosis? The correct answer is a Pancoast tumor. An apical lung tumor can invade the lower brachial plexus, causing arm or hand weakness, and the cervical sympathetic chain, producing Horner syndrome. Why the other choices are wrong? A cerebellar artery aneurysm does not produce this combination of brachial plexopathy and Horner syndrome. Diabetic third nerve palsy typically causes ptosis and extraocular movement abnormalities, often with pupil sparing, not distal arm weakness. Myasthenia gravis causes fatigable weakness without pupillary abnormalities. Lambert-Eaton syndrome produces proximal weakness and autonomic symptoms, not unilateral Horner syndrome with focal hand weakness. High-yield takeaway. Smoker plus shoulder or arm neurologic symptoms plus Horner syndrome equals Pancoast tumor. Determine how tuberculosis reached a cervical lymph node in an untreated patient with HIV whose node biopsy contains acid-fast bacilli and tests positive for Mycobacterium tuberculosis. The infection in this patient most likely reached the cervical lymph nodes through which of the following routes? The correct answer is hematogenous spread from the lungs. Tuberculosis is acquired through the respiratory tract and can disseminate through blood and lymphatics to extrapulmonary sites, especially in immunocompromised patients. Why the other choices are wrong. Direct skin inoculation is not the usual route of tuberculous lymphadenitis. Direct extension from hilar lymph nodes would not explain a distant cervical node as well as dissemination. Routine lymphatic drainage from pharyngeal tissue is not the classic source for M. tuberculosis here. Trafficking of infected lymphocytes is not the standard pathophysiologic description of spread to this site. High-yield takeaway. Extrapulmonary TB in immunocompromised patients often reflects dissemination from a pulmonary infection, even when lung findings are subtle. Identify what additional history is most important in a man who appears to have resistant hypertension despite 4 antihypertensive medications. Specific additional history should be obtained regarding which of the following? The correct answer is his medication refill pattern. Before diagnosing true resistant hypertension, confirm that the patient is actually obtaining and taking the prescribed medications. Why the other choices are wrong. Caffeine can transiently increase blood pressure, but is usually not the main explanation for severe apparent resistance. Exercise history matters for long-term cardiovascular risk, but does not establish medication adherence. Fast food intake may increase sodium exposure, but is less important than verifying whether the prescribed regimen is being taken. High-yield takeaway. Before calling hypertension resistant, rule out pseudo-resistance from non-adherence, poor measurement technique, white coat effect, and interfering substances. Identify which laboratory abnormality is most likely in an 8-week pregnant woman with persistent vomiting, concentrated urine, and markedly decreased urine output. Which of the following laboratory study results is most likely to be abnormal in this patient? The correct answer is an elevated serum urea nitrogen concentration from pre-renal volume depletion. Vomiting causes dehydration, and the kidney responds by increasing proximal sodium, water, and urea reabsorption. Why the other choices are wrong. Leukocytosis is not required, and there is no evidence of infection. AST and ALT may be mildly elevated in severe hyperemesis, but are not the most direct expected abnormality in this volume-depleted presentation. Calcium and glucose are not expected to be the defining abnormalities. Saying no abnormality is likely ignores the evidence of significant dehydration and oliguria. High-yield takeaway. Dry patient plus concentrated urine and oliguria equals pre-renal physiology, often with a disproportionately increased BUN. Identify what substance is most likely involved in a jailed 30-year-old with yawning, diaphoresis, mydriasis, abdominal cramping, diarrhea, arthralgias, and autonomic hyperactivity. Results of urine toxicology screening in this patient will most likely be positive for which of the following? The correct answer is opioids. These are classic findings of opioid withdrawal after abrupt cessation. Why the other choices are wrong. Cannabinoid withdrawal can cause irritability and sleep disturbance, but not this dramatic autonomic and gastrointestinal syndrome. Cocaine withdrawal more often causes fatigue, depressed mood, increased sleep, and craving, rather than diarrhea and mydriasis with yawning. Methamphetamine withdrawal similarly causes a crash with fatigue and depression, rather than this opioid withdrawal pattern. High yield takeaway. Opioid overdose gets small and slow. Opioid withdrawal opens everything up. Mydriasis, diarrhea, rhinorrhea, lacrimation, piloerection, and yawning. Select the first evaluation of new fever, tachypnea, diaphoresis, and decreased left basilar breath sounds in a hospitalized patient with acute pancreatitis. Which of the following is the most appropriate next step in the evaluation of these new findings? The correct answer is a chest X-ray. Pancreatitis can produce pulmonary complications such as pleural effusion, atelectasis, pneumonia, or ARDS, and chest radiography is the appropriate initial study for these new thoracic findings. Why the other choices are wrong. Cardiac enzymes are not the first test for this respiratory pattern without ischemic symptoms. Echocardiography evaluates cardiac structure and function, not the likely pulmonary complication. Chest ultrasound can characterize pleural fluid, but is not the broad first study when the diagnosis is not yet established. A ventilation perfusion scan is directed toward pulmonary embolism and is not the first step given the focal basilar finding in pancreatitis-associated pulmonary complications. High-yield takeaway. When a hospitalized patient develops new respiratory findings, start with the appropriate basic chest imaging before jumping to specialized tests. Determine how to counsel parents of an 11-year-old boy who want to defer HPV vaccination because they expect him to remain abstinent until marriage. Which of the following is the most appropriate response to the parents? The correct answer is to explain that even if he waits until marriage, a future partner may previously have been exposed to HPV. Vaccination is most effective before exposure and is primarily cancer prevention. Why the other choices are wrong. Framing the discussion around vague vaccine risks exaggerates concern and is not the best counseling message. Population-level elimination is not the most patient-centered reason to recommend vaccination. Simply handing out literature and encouraging deferral misses the benefit of vaccinating before potential exposure. High-yield takeaway. HPV vaccine protects against future exposure and HPV-related cancers. It is not a prediction about a child's future sexual behavior. Identify what to do when an alert, fully oriented 77-year-old with limb-threatening gangrene refuses a recommended amputation despite understanding that refusal could be fatal. Which of the following is the most appropriate action for this physician to take? The correct answer is to abide by the patient's wishes. A competent patient may refuse even life-saving treatment after an informed discussion of risks, benefits, and alternatives. Why the other choices are wrong. An ethics consultation is not needed simply because the physician disagrees with a capacitated decision. The sons cannot consent over the objection of a competent patient. A court cannot be used to override a competent adult's informed refusal. The healthcare proxy becomes the decision maker only if the patient loses capacity. A living will does not supersede the patient's current capacitated wishes. High-yield takeaway. Capacity beats proxy. Autonomy includes the right to make a decision that clinicians believe is medically unwise. Identify what explains JVD, a parasternal heave, hepatomegaly, ascites, and peripheral edema in a man with severe chronic lung disease and hypoxemia. Which of the following is the most likely underlying explanation for this patient's condition? The correct answer is pulmonary vascular compromise leading to cor pulmonale. Chronic hypoxic pulmonary vasoconstriction causes pulmonary hypertension, which eventually produces right ventricular hypertrophy and right-sided heart failure. Why the other choices are wrong. Superior vena cava obstruction causes upper body venous congestion rather than the full right heart failure pattern with hepatomegaly and ascites. A perforated ulcer would cause acute abdominal catastrophe, not chronic pulmonary hypertension signs. Lactic acidosis from systemic hypoperfusion does not explain the structural right-sided findings. Widespread hepatocellular necrosis may occur in shock, but would be a consequence rather than the unifying cause. High-yield takeaway. Chronic lung disease plus pulmonary hypertension plus right-sided failure equals cor pulmonale. Identify which additional symptom best fits a 39-year-old woman with weight loss, tachycardia, and fine tremor from hyperthyroidism. Which of the following additional signs or symptoms would be most consistent with the underlying diagnosis in this patient? The correct answer is heat intolerance. Excess thyroid hormone raises basal metabolic rate and thermogenesis. Why the other choices are wrong. Constipation is more typical of hypothyroidism. Hyperthyroidism usually causes increased bowel movements. Delayed relaxation of deep tendon reflexes is a classic hypothyroid finding. Skin tinting suggests dehydration rather than thyroid hormone excess. High-yield takeaway. Hyperthyroidism is hot, fast, tremulous, and often thin. Identify what best predicts long-term seizure control after temporal lobectomy in patients with medically refractory temporal lobe epilepsy. Which of the following is the most appropriate conclusion to draw from these data regarding seizure recurrence after the procedure? The correct answer is absence of seizures 2 years after surgery. Sustained early postoperative seizure freedom is the strongest predictor in the presented Kaplan-Meier data of continued long-term seizure freedom. Why the other choices are wrong. The graph does not show that most recurrences cluster specifically between years 2 and 3. The claim that only 30% are seizure-free at 6 months misreads the survival curve. The subgroup analysis does show meaningful separation, so saying no conclusion is possible because of statistical insignificance is incorrect. High-yield takeaway. With Kaplan-Meier curves, read the actual survival or event-free curves and p-values rather than inferring from isolated points. Identify which genetic mutation is most likely in a 5-year-old boy with Gowers sign, calf pseudohypertrophy, proximal weakness, cognitive delay, and a creatine kinase of 25,000. Which of the following mutations is most likely to be identified in this patient? The correct answer is a large deletion in the dystrophin gene, causing Duchenne muscular dystrophy. Duchenne is an X-linked dystrophinopathy in which out-of-frame deletions frequently eliminate functional dystrophin. Why the other choices are wrong. Type 3 collagen mutations cause Ehlers-Danlos-related connective tissue disease, not this muscular dystrophy. Fibrillin 1 mutations cause Marfan syndrome. Spectrin defects cause red cell membrane disorders such as hereditary spherocytosis. Myosin gene translocations do not produce the classic Duchenne phenotype. High-yield takeaway. Duchenne equals absent functional dystrophin, proximal weakness, Gowers sign, calf pseudohypertrophy, and very high CK. Identify which drug mechanism best explains profound bradycardia and hypotension in a somnolent woman whose urine happens to be positive for opiates, but who has dilated pupils and normal respirations. An overdose of a drug with which of the following mechanisms of action is the most likely cause of this patient's condition? The correct answer is beta-1 adrenergic receptor blockade, meaning a beta blocker overdose. Severe beta blocker toxicity produces bradycardia, hypotension, and shock. Why the other choices are wrong. Mu-opioid agonism should produce respiratory depression and usually meiosis, which are absent. Aldosterone inhibition can cause hyperkalemia and hypotension, but not this striking bradycardic toxidrome. A CE inhibition may cause hypotension, but not profound isolated bradycardia. Serotonin reuptake inhibition does not cause this pattern. Prostaglandin inhibition and renal sodium chloride reabsorption inhibition also do not explain severe bradycardia. High-yield takeaway. Interpret the toxidrome, not just the toxicology screen. Identify which molecular target should be used to improve walking distance in a woman with intermittent claudication and abnormal ankle brachial indices. The most appropriate pharmacotherapy for this patient targets which of the following? The correct answer is phosphodiesterase. Cilostazol inhibits phosphodiesterase type 3, increases cyclic AMP, produces vasodilation, and inhibits platelet aggregation, improving claudication symptoms. Why the other choices are wrong? Cyclooxygenase inhibition provides analgesic or antiplatelet effects depending on the agent, but does not specifically improve claudication walking distance. Factor Xa inhibition is anticoagulation and is not the treatment for stable peripheral claudication. Nitric oxide synthase is not the therapeutic target here. Prostacyclin synthase is not the mechanism of cilostazol. High-yield takeaway. Cilostazol helps patients stroll, but avoid it in heart failure. Select the initial test in a 39-year-old woman with progressive exertional dyspnea, a parasternal lift, prominent P2, and other findings suggesting pulmonary hypertension. Which of the following is the most appropriate additional diagnostic study? The correct answer is echocardiography. Echo non-invasively estimates pulmonary pressures and evaluates right ventricular size and function and associated structural heart disease. Why the other choices are wrong? CT, chest, may evaluate lung disease or pulmonary vascular anatomy, but is not the first hemodynamic screen. A perfusion scan is useful when chronic thromboembolic pulmonary hypertension is suspected after the initial evaluation. Pulmonary function testing assesses obstructive or restrictive lung disease, but does not directly assess the suspected pulmonary hypertension. Thyroid ultrasonography is irrelevant to the cardiopulmonary findings. High-yield takeaway. Suspected pulmonary hypertension starts with echo. Right heart catheterization is the definitive hemodynamic test. Determine whether a study can conclude that an osteoporosis drug prevents fractures when it only demonstrated preservation of bone mineral density. Which of the following is the most appropriate conclusion to draw from these data? The correct answer is that the effect on bone density may not correlate with fracture risk. Bone mineral density is a surrogate endpoint, and an improvement in a surrogate does not automatically prove improvement in the patient-centered clinical outcome. Why the other choices are wrong? A randomized trial can show no change in bone density without implying an uncontrolled confounder. The result does not show that the medication regimen was too complicated. Excluding women younger than 40 does not invalidate the stated study population of women aged 40 to 60. Recruiting from general gynecology clinics does not by itself establish selection bias severe enough to explain the central problem. High-yield takeaway. A better surrogate number does not always mean a better patient. Fractures, disability, hospitalization, and mortality are harder clinical outcomes. A 78-year-old nursing home resident with 10 days of new confusion and drowsiness, who has a history suggesting a recent fall or minor head trauma. Which of the following is the most likely explanation for the patient's worsening condition? The correct answer is head trauma, with concern for a subdural hematoma. Older adults are vulnerable because cerebral atrophy stretches bridging veins, and even minor trauma can produce delayed neurologic decline. Why the other choices are wrong. There has been no medication change to suggest a new drug interaction. Hypothyroidism usually produces a more chronic syndrome rather than an abrupt 10-day decline. Major depression does not typically cause fluctuating drowsiness and objective acute confusion. Viral encephalitis generally causes fever or other acute neurologic signs and is less consistent with this subacute post-traumatic pattern. High-yield takeaway. Older patient plus delayed confusion after even minor trauma equals think subdural hematoma. A 28-year-old woman who has developed episodic anxiety after a major recent divorce. Given the evidence at this time, which of the following is the most likely diagnosis? The correct answer is adjustment disorder with anxiety. The symptoms developed in temporal association with an identifiable psychosocial stressor, and there is not yet enough evidence for a more specific anxiety disorder. Why the other choices are wrong. Agoraphobia requires fear and avoidance of situations where escape may be difficult. Dysthymic disorder, now persistent depressive disorder, requires chronic depressive symptoms rather than episodic anxiety. Generalized anxiety disorder requires excessive anxiety about multiple domains on most days for at least 6 months. PTSD requires exposure to a qualifying traumatic event, plus characteristic intrusion, avoidance, mood, and arousal symptoms. High-yield takeaway. Identifiable stressor plus a sub-threshold emotional syndrome, beginning within 3 months, suggests adjustment disorder. Identify what MRI would show in a 17-year-old football player with immediate bilateral leg weakness, sensory loss below the chest, and absent lower extremity reflexes after a direct thoracic injury. MRI of the spine is most likely to show which of the following? The correct answer is contusion of the thoracic spinal cord. Acute traumatic cord injury can initially produce spinal shock with flaccidity and areflexia below the lesion. Why the other choices are wrong. Anterior spinal artery ischemia produces a characteristic vascular syndrome and is not the most likely consequence of this direct blunt trauma. A lateral disc herniation would cause a focal radiculopathy rather than bilateral cord-level deficits. Cord hemisection would produce a Brown-Séquard pattern with asymmetric motor and sensory findings. A traumatic syrinx is a delayed complication, not an immediate 1-hour presentation. High-yield takeaway. Spinal shock means temporary flaccidity and areflexia after acute cord injury. Later upper motor neuron signs emerge. Determine whether dialysis should be started after a patient who had capacity explicitly refused it and later became encephalopathic from progressive renal failure. Which of the following is the most appropriate course of action? The correct answer is to continue current management without initiating hemodialysis. Her prior informed, capacitated refusal remains controlling after she loses capacity. Why the other choices are wrong. Starting dialysis and changing her code status ignores her stated wishes. Starting dialysis while preserving DNAR still violates her refusal of dialysis. Her daughter cannot override a known prior autonomous decision simply because the patient is now incapacitated. High-yield takeaway. When a patient loses capacity, known prior wishes outrank surrogate preference. Determine how to evaluate a 75-year-old woman with abrupt syncope, no prodrome, an abnormal cardiac risk profile, and no clear benign explanation. Which of the following is the most appropriate next step in evaluation? The correct answer is telemetry observation. The absence of warning symptoms and concern for a possible arrhythmia make monitored inpatient evaluation appropriate. Why the other choices are wrong. EEG is not indicated without features suggesting seizure. A 24-hour outpatient monitor may miss an immediately dangerous rhythm and is less appropriate in a high-risk presentation. Outpatient echocardiography may eventually be useful for structural disease, but does not provide immediate rhythm monitoring. Tilt testing is for suspected reflex or orthostatic syncope after dangerous cardiac causes have been reasonably excluded. High-yield takeaway. Unexplained high-risk syncope, especially without prodrome or with cardiac disease, deserves monitored evaluation. Determine whether an institutional review board should reject an otherwise ethical, federally funded case control study because the institution fears possible liability if dental x-rays are associated with thyroid cancer. Which of the following is the most appropriate response by the IRB regarding the member's concern? The correct answer is to approve the study as submitted. The IRB's role is protection of research participants, not suppression of ethically appropriate research because the result could create institutional legal risk. Why the other choices are wrong. Rejecting the study solely for liability concerns is not an appropriate research ethics basis. Consent forms should not need special language promising a right to sue if an association is found. They also may not contain exculpatory language that asks participants to waive legal rights or releases investigators or institutions from negligence. High-yield takeaway. Informed consent explains risks and rights. It does not erase legal rights. Identify what histology is most likely in a 15-year-old boy with a large, progressively enlarging chest wall mass suspicious for sarcoma. Biopsy of this mass is most likely to show which of the following. The correct answer is poorly differentiated anaplastic spindle cells consistent with a malignant mesenchymal tumor. Why the other choices are wrong. Acid-fast bacilli would suggest mycobacterial infection. Gram-positive cocci in clusters suggests staphylococcal infection or abscess. Infiltrating squamous nests with keratin describes squamous cell carcinoma, which is not the typical chest wall tumor in an adolescent. Malignant syncytiotrophoblasts and cytotrophoblasts describe choriocarcinoma or another germ cell component rather than a primary chest wall sarcoma. High-yield takeaway. Aggressive bone or soft tissue masses in children and adolescents should make you think sarcoma. Localize where injury is occurring in a 66-year-old woman with new, severe odenophagia while taking oral alendronate. Endoscopy is most likely to show ulceration of which of the following structures? The correct answer is the esophagus. Oral bisphosphonates can cause significant pill esophagitis and ulceration. Why the other choices are wrong. The duodenum, gastric cardia, gastric fundus, and pylorus are not the characteristic sites of alendronate's classic administration-related injury. High-yield takeaway. Take oral bisphosphonates with a full glass of water and remain upright for at least 30 minutes. Bisphosphonate means do not lie down. Identify what pathologic process explains fixed airflow obstruction with minimal bronchodilator response in a 72-year-old heavy smoker. Which of the following is the most likely underlying cause of this patient's condition? The correct answer is destruction of alveolar walls with enlargement of air spaces, which defines emphysema. Loss of elastic recoil causes expiratory airflow limitation and air trapping. Why the other choices are wrong. Bacterial colonization is associated with chronic bronchitis exacerbations, but does not define emphysema. Allergen-triggered bronchoconstriction suggests asthma and should show more reversibility. Patchy interstitial inflammation and fibrosis produce restrictive rather than obstructive physiology. Eosinophilic interstitial infiltration suggests an eosinophilic lung process, not smoking-related emphysema. High-yield takeaway. Emphysema destroys alveolar walls. Chronic bronchitis produces mucus hypersecretion. Identify what study design is used when researchers survey a random sample of physicians once and measure their current beta-blocker prescribing patterns. Which of the following most accurately characterizes this study design? The correct answer is a cross-sectional study. Exposure or characteristic and outcome information are collected at one point in time, creating a snapshot of current prevalence. Why the other choices are wrong. A case control study starts with outcome status and looks backward for exposures. A case series describes a group of patients without a comparison design. A clinical trial assigns an intervention. A prospective cohort follows exposure groups forward in time. A retrospective cohort reconstructs follow-up using existing historical data. High-yield takeaway. Cross-sectional equals snapshot and is especially useful for prevalence. A 79-year-old man with several days of dizziness, gait instability, and horizontal nystagmus that changes with position but no focal neurologic deficit. Which of the following is the most likely diagnosis? The correct answer is labyrinthitis, representing a peripheral vestibular disorder in the terminology of this item. The positional nystagmus and imbalance without a focal central neurologic syndrome favor a peripheral labyrinthine process. Why the other choices are wrong? A cardiac arrhythmia causes presyncope or syncope rather than reproducible positional vertigo with nystagmus. Remote, moderate alcohol use does not explain a new acute vestibular syndrome. Orthostatic hypotension requires a significant blood pressure drop with standing rather than positional nystagmus. Stroke becomes more concerning with focal neurologic deficits, severe truncal ataxia, or central nystagmus features that are not described here. High-yield takeaway. Vertigo plus positional horizontal nystagmus and no focal neurologic findings favors a peripheral vestibular cause. Identify what most likely caused a pressure-related foot lesion in a frail, bed-bound 73-year-old man after a prolonged hospitalization. Which of the following is the most likely underlying cause of this patient's condition? The correct answer is prolonged immobility. Continuous pressure over a bony prominence impairs local perfusion and produces a pressure injury. Why the other choices are wrong? MRSA can secondarily infect a wound, but does not explain the primary pressure pattern. Pyoderma gangrenosum is a painful, inflammatory ulcer with undermined violaceous borders and is not caused by bed pressure. Systemic atheroemboli typically cause painful blue toes or livido with preserved pulses rather than a classic pressure site lesion. Chronic venous insufficiency usually causes edema and ulcers near the medial malleolus rather than a pressure injury on a bed-bound patient's foot. High-yield takeaway. Prevent and treat pressure injuries by offloading pressure, repositioning, controlling moisture, and optimizing nutrition. Identify what most likely caused cardiac arrest in an 8-year-old girl with profound bradycardia and asystole rather than an atherosclerotic event. Which of the following is the most likely underlying cause of this patient's death? The correct answer is a cardiac conduction abnormality. Sudden collapse or arrest in a child should raise concern for an inherited electrical disorder or channelopathy that can produce malignant bradyarrhythmia or tachyarrhythmia. Why the other choices are wrong? Coronary plaque rupture is extraordinarily unlikely in an otherwise young child. Increased pulmonary vascular resistance would require a pulmonary or congenital heart disease context. Mitral valve prolapse is common and usually benign and does not explain prolonged asystole. A thickened left ventricle could suggest hypertrophic cardiomyopathy, but the described arrest is dominated by severe conduction disturbance rather than an obstructive hypertrophic phenotype. High-yield takeaway. Sudden cardiac death in the young means think electrical or structural inherited disease before atherosclerosis. Select the best diagnostic test in a non-pregnant 37-year-old woman with severe colicky flank or abdominal pain radiating toward the pelvis and finding suspicious for ureteral stone. Which of the following is the most appropriate next step in evaluation? The correct answer is a non-contrast helical CT scan of the abdomen. It is highly sensitive for urinary calculi and can also identify alternative abdominal diagnoses. Why the other choices are wrong? Cystoscopy directly visualizes the bladder and urethra, but is not the first diagnostic test for an upper urinary stone. Exploratory laparotomy is far too invasive for stable, suspected nephrolithiasis. A plain KUB misses radiolucent stones and is less sensitive than CT. No further testing is inappropriate with severe new pain requiring confirmation of the diagnosis and exclusion of dangerous alternatives. High-yield takeaway. Non-pregnant adult with classic renal colic usually gets non-contrast CT. Pregnancy and selected low-risk settings favor ultrasound first. Determine how to evaluate recurrent postmenopausal spotting in a 55-year-old woman with obesity and diabetes. Which of the following is the most appropriate diagnostic study at this time? The correct answer is endometrial biopsy. Postmenopausal bleeding must be evaluated for endometrial hyperplasia or carcinoma, and her metabolic risk factors increase concern. Why the other choices are wrong. ACBC can assess anemia but does not determine the source of bleeding. Pelvic CT is not the initial test for endometrial pathology. Hysterosalpingography evaluates the uterine cavity and fallopian tubes, mainly in infertility, and is not used for postmenopausal bleeding. CA125 is not a screening test for endometrial cancer and is mainly used in selected ovarian cancer contexts. High-yield takeaway. Postmenopausal bleeding is endometrial cancer until adequately excluded. Depending on the exact patient, transvaginal ultrasound or biopsy can be the initial strategy. This STEM calls for biopsy. Determine how to respond when the father of a 2-year-old with straightforward lymphadenitis asks for a specialist because of a family history of malignancy. In addition to expressing empathy, which of the following is the most appropriate physician response? The correct answer is, tell me what your greatest concerns are. This open-ended response explores the emotion and reasoning behind the request before agreeing, refusing, or reassuring. Why the other choices are wrong. Saying she does not need a specialist before asking what worries him is prematurely dismissive. Saying the physician is confident and sees no need for referral gives reassurance before understanding the concern. Promising she will improve after antibiotics is overly certain and closes discussion. Asking why he thinks she needs a specialist can sound challenging or defensive rather than inviting. High-yield takeaway. Explore the concern before correcting the concern. Identify what to do first when an 88-year-old woman with severe dementia, rectal bleeding, and no decision-making capacity becomes combative during examination. Which of the following is the most appropriate initial intervention? The correct answer is to contact her healthcare proxy to discuss how to proceed. For a non-emergent invasive evaluation in an incapacitated patient, the legally authorized surrogate should guide decisions using the patient's known wishes or best interests. Why the other choices are wrong. Sedating her simply to force an examination exposes her to risk and bypasses surrogate decision-making. Physical restraints should not be used merely for convenience to complete a non-urgent examination. Discharging her for outpatient sigmoidoscopy ignores active rectal bleeding and the need for an appropriate current evaluation. High-yield takeaway. Capacity absent means involve the surrogate, use sedation or restraints only when clinically necessary for immediate safety, not simply to overcome refusal. Determine how to evaluate chronic constipation in a 64-year-old woman who has soft stool in the rectal vault and decreased sphincter tone despite fiber therapy. Which of the following is the most appropriate next step in management? The correct answer is anorectal manometry. The findings suggest a defecatory or pelvic floor disorder, and manometry evaluates anorectal pressures and coordination during attempted defecation. Why the other choices are wrong. Adding bicicodal may increase colonic propulsion, but does not diagnose or correct an outlet dysfunction. Repeat colonoscopy is not indicated without alarm features and after a recent normal study. Lisinopril is not a typical cause of constipation, and stopping it would not address the findings. A bowel diary may quantify symptoms, but is not sufficient once an anorectal dysfunction is suspected. High-yield takeaway. If soft stool reaches the rectum but evacuation is impaired, think outlet dysfunction and test anorectal mechanics. Select immediate treatment of a 72-year-old man with a pulse of 30, blood pressure of 75/35, altered mentation, diaphoresis, and pulmonary congestion. Which of the following is the most appropriate next step in management? The correct answer is transcutaneous pacing. This is unstable, symptomatic bradycardia with shock, and rapid pacing is required when immediate chronotropic support is needed. Why the other choices are wrong. Adenosine slows AV nodal conduction and would worsen bradycardia. Dobutamine can increase contractility, but is not the primary intervention for profound, unstable bradycardia. Epinephrine infusion can be used as a bridge when pacing is unavailable or ineffective, but pacing is the best offered next step. Defibrillation is used for pulseless ventricular tachycardia or ventricular fibrillation, not bradycardia with a pulse. Intubation may become necessary if ventilation fails, but does not correct the cause of shock. High-yield takeaway. Unstable bradycardia means atropine when appropriate, then pace or use a chronotropic infusion without delay. Identify which over-the-counter medication a 14-year-old likely abused after developing altered behavior followed by lethargy, hypoventilation, meiosis, and decreased bowel sounds. The most likely cause of this patient's condition is abuse of which of the following medications? The correct answer is dextromethorphan. At supratherapeutic doses, dextromethorphan can cause major neurobehavioral toxicity and CNS depression, and cough preparations are readily available to adolescents. Why the other choices are wrong. Diazepam can cause sedation and hypoventilation, but is not the characteristic readily abused OTC cough medicine in this setup. Diphenhydramine overdose more often causes an anticholinergic syndrome with mydriasis, dry skin, tachycardia, and delirium. Methylphenidate causes sympathomimetic stimulation rather than lethargy and bradypnea. Phenylephrine causes adrenergic effects such as hypertension and reflex bradycardia, not this CNS toxidrome. High-yield takeaway. Adolescent with bizarre behavior or dissociation after access to cough medicine should make you consider dextromethorphan abuse. Identify what home service is most important after a 65-year-old woman with a hip fracture receives a prosthetic hip and is preparing to return home. At this time, it is most appropriate to arrange for home services to do which of the following? The correct answer is assistance strengthening her lower extremity muscles. Restoring leg strength, gait, transfers, and balance directly determines her ability to ambulate safely after hip surgery. Why the other choices are wrong. She can learn to self-administer insulin and does not require a home service solely to inject it. Upper body strengthening may help walker use, but is secondary to lower extremity rehabilitation. Diet adherence is important, but is not the main functional barrier created by the hip fracture. Daily glucose monitoring is necessary with insulin, but can usually be performed by the patient or caregiver and does not address the central rehabilitation need. High-yield takeaway. Discharge planning should target the patient's actual functional deficit. Identify what occupational function most needs focused assessment in a right-handed graphic designer after right parietal tumor resection who has left-sided extinction. In considering this patient's ability to resume work, focused evaluation to determine which of the following is most likely to be helpful. The correct answer is the effect of hemi-inattention on visuospatial skills. A right parietal lesion can cause left hemispatial neglect, which is especially important for work that depends on visual spatial processing. Why the other choices are wrong. Her speech is fluent, and there is no evidence that expressing ideas is impaired. Mild left-hand weakness matters, but keyboard control is less directly related to the parietal neglect being demonstrated. She has mild gait impairment, but overall ambulation is less important to graphic design performance than visuospatial awareness. High-yield takeaway. Right parietal injury neglects the left side of space. Identify which medication is causing new bruising and fatigue in a 75-year-old woman with hyperthyroidism whose blood counts show marrow suppression. Which of the following medications is the most likely cause of this patient's symptoms? The correct answer is methimazole. Thionamides can cause agranulocytosis and, rarely, broader bone marrow toxicity. Why the other choices are wrong. Aspirin can impair platelet function and increase bleeding, but does not cause the characteristic profound neutropenia or marrow suppression. Atorvastatin can cause myopathy or liver enzyme elevations, not this blood count pattern. Carvedilol can cause bradycardia and hypotension. Lisinopril can cause cough, hyperkalemia, and angioedema, but is not the likely cause of this cytopenic syndrome. High-yield takeaway. Fever or sore throat on methimazole means stop the drug and check a CBC immediately. Identify which feature most worsens prognosis in a 45-year-old woman with amyotrophic lateral sclerosis and prominent dysarthria, dysphagia, and tongue weakness. Which of the following factors in this patient's history most negatively impacts her life expectancy? The correct answer is bulbar weakness. Bulbar involvement increases aspiration, nutritional, and respiratory complications and is associated with shorter survival. Why the other choices are wrong. Her age matters to prognosis in general, but is less adverse than established bulbar disease in this stem. Prior cervical fusion does not determine ALS survival. Fasciculations are a lower motor neuron sign, but do not independently carry the same prognostic weight as bulbar dysfunction. Sex is not the dominant prognostic factor here. High-yield takeaway. ALS combines upper and lower motor neuron findings with preserved sensation. Bulbar involvement is a bad prognostic sign. Identify what to do next in a woman who develops fever and profound neutropenia 3 weeks after starting methimazole. Which of the following is the most appropriate next step? The correct answer is immediate empiric cefepime therapy after stopping methimazole. Febrile neutropenia is a medical emergency and requires prompt anti-pseudomonal antibiotics. Why the other choices are wrong. An ANA does not address the acute, life-threatening infectious risk. Bone marrow biopsy is not the first step when a clear drug cause and febrile neutropenia are present. Filgrastim may be considered in selected high-risk cases, but does not replace immediate antibiotics. HIV testing does not take priority over treatment of febrile neutropenia. Propylthiouracil is another thionamide and should not simply replace methimazole in the setting of severe thionamide-induced agranulocytosis. High-yield takeaway. Fever plus severe neutropenia equals broad anti-pseudomonal antibiotics now. Determine how to treat a premature ventilated newborn with abrupt severe hypotension and hypoxemia whose chest X-ray shows air around the heart causing tamponade physiology. Which of the following is the most appropriate management of this patient's condition? The correct answer is pericardiocentesis. Tension pneumopericardium can impair cardiac filling and cause cardiovascular collapse, requiring immediate decompression. Why the other choices are wrong. Inserting a central venous catheter does not relieve tamponade and could delay definitive treatment. Median sternotomy is unnecessarily invasive for initial emergency decompression. Reducing PEEP may reduce further air leak, but does not rapidly evacuate existing life-threatening pericardial air. A left chest tube treats pneumothorax, not isolated pneumopericardium. High-yield takeaway. Treat obstructive shock from tamponade physiology by immediate decompression. Do not wait for perfect diagnostic certainty. Determine when a healthy 38-year-old woman with a normal pap test and negative HPV co-test should next undergo cervical screening under the screening strategy used in the item. If results from the most recent cervical cytology and HPV test are normal, at which of the following times should this patient have her next cervical cytology? The correct answer is in 5 years. A negative cytology plus high-risk HPV co-test allows a 5-year screening interval in the guideline framework tested here. Why the other choices are wrong. Menopause does not determine the next screening date. 1 year is unnecessarily frequent after a negative co-test in an average-risk patient. Pregnancy does not trigger routine cervical screening on its own. At age 38, normal prior screening does not mean she never needs screening again. High-yield takeaway. Screening interval depends on age and modality. For this exam item, negative PAP plus HPV co-testing means 5 years. Identify what to do before repeating a trigger point injection in a woman who develops severe delayed itching and erythema after an unknown local anesthetic. Which of the following is the most appropriate next step in management? The correct answer is referral to an allergist for further evaluation. The exact drug and whether the reaction involved the anesthetic itself or another component are unknown, so testing and clarification should occur before re-exposure. Why the other choices are wrong. Phenol is not a routine substitute local anesthetic and can be neurolytic. Prilocaine and tetracaine should not be given blindly when the culprit class is unknown. Pre-treating with an antihistamine does not make an uncertain, potentially important drug reaction safe. High-yield takeaway. An unclear, clinically significant drug allergy plus likely future exposure should be clarified rather than guessed around. Identify what to do with an isolated PET-avid 1 centimeter lung metastasis 1 year after treatment of stage 3 colon cancer when there is no other evidence of disease. Which of the following is the most appropriate next step in management? The correct answer is resection of the pulmonary nodule. Selected patients with a solitary, technically resectable colorectal metastasis can benefit from metastasectomy with curative intent. Why the other choices are wrong. Bronchoscopy is not necessary when the lesion is being approached as a resectable, isolated metastasis and may have low yield for a small peripheral nodule. Systemic chemotherapy alone is not automatically preferred over potentially curative local resection. Palliative care is premature when oligometastatic disease is potentially resectable. Radiation may be considered in patients who cannot undergo surgery, but is not the best answer for an operable solitary lesion. High-yield takeaway. Limited metastatic disease is not always palliative-only disease. Resectability and total disease burden matter. Identify which food poses a particularly dangerous infection risk in a man with hemochromatosis. This patient should be counseled that he is at increased risk for mortality if he consumes which of the following foods? The correct answer is raw oysters. Iron overload strongly increases susceptibility to severe Vibrio vulnificus infection, which can cause fulminant sepsis and death after raw shellfish ingestion. Why the other choices are wrong. Bean sprouts can transmit enteric organisms such as Salmonella or E. coli, but have no special classic association with hemochromatosis. Berries may transmit foodborne infections, but are not the signature risk. Undercooked eggs are associated with salmonella, but not the uniquely severe iron overload association seen with Vibrio. High-yield takeaway. Hemochromatosis or cirrhosis plus raw oysters equals high-risk Vibrio vulnificus. Fertility prognosis in a 19-year-old with sudden, severe testicular pain, vomiting, a transverse high-riding testicle, and likely testicular torsion. At this time, it is most appropriate to inform the patient of which of the following. The correct answer is that fertility will most likely be unaffected if the torsion is immediately reversed. Prompt detorsion maximizes testicular salvage and preserves endocrine and reproductive function. Why the other choices are wrong. It is too early to say functional testicular tissue has already been lost. Conservative management is unsafe because torsion requires emergency detorsion and fixation. Further testing should not delay surgery when clinical suspicion is high. High-yield takeaway. Torsion equals time is testicle. Sudden, severe, unilateral testicular pain with abnormal lie requires immediate urologic action. Determine how to control severe postoperative knee pain in an obese man who repeatedly becomes apneic and hypoxemic after systemic opioids. Which of the following is the most appropriate next step to decrease this patient's risk for postoperative respiratory events? The correct answer is a bupivacaine femoral nerve block. Regional anesthesia provides strong local analgesia while reducing systemic opioid exposure and the resulting respiratory depression. Why the other choices are wrong. High-flow nasal cannula can support oxygenation but does not solve the opioid-sensitive pain control problem. Chest wall impedance monitoring detects respiratory changes but does not reduce opioid requirements. Continuous pulse oximetry is prudent monitoring but is not analgesic therapy. A hydromorphone PCA would increase exposure to the medication already causing dangerous apnea. High-yield takeaway. If systemic opioids threaten ventilation, use multimodal and regional analgesia when appropriate. Identify which historical factor most worsens prognosis after a large acetaminophen overdose in a 32-year-old who also consumed a large amount of alcohol. Which of the following factors in this patient's history most strongly indicates a poor prognosis? The correct answer in this item is concurrent heavy alcohol exposure. Alcohol use patterns, poor nutrition, and altered hepatic redox and glutathione physiology can increase concern for hepatotoxicity in acetaminophen overdose, although the metabolic effect of a single acute ethanol exposure is nuanced. Why the other choices are wrong. Her hepatitis B serology shows prior resolved infection, not chronic active hepatitis B. Fluoxetine is not a major determinant of acetaminophen-induced hepatic failure. Type 1 diabetes does not independently carry the same prognostic significance for acetaminophen hepatotoxicity. High-yield takeaway. Acetaminophen overdose is treated with N-acetylcysteine, which replenishes glutathione. Do not delay NAC when significant toxicity is possible. Identify which feature most raises concern that a thyroid nodule in a 35-year-old woman could be malignant. Which of the following factors in this patient is most indicative of a poor prognosis? The correct answer is prior neck radiation. Childhood mantle field radiation is a major risk factor for later thyroid carcinoma. Why the other choices are wrong. Cigarette smoking is not a major classic thyroid cancer risk factor. Hyperthyroidism is not established here, and many hyperfunctioning nodules are actually less likely to be malignant. Iodine deficiency changes patterns of thyroid disease, but is not the strongest risk factor in this patient. Multiple nodules do not make the overall gland safe or dangerous by themselves. Individual sonographic features and history matter. High-yield takeaway. Thyroid nodule plus childhood head or neck radiation is high risk. Determine how to treat an infant with painful, grouped vesicles on the thumb and index finger, plus perioral vesicles consistent with herpetic Whitlow. Which of the following is the most appropriate pharmacotherapy? The correct answer is oral acyclovir. HSV infection is the unifying cause of the vesicular, oral, and digital lesions. Why the other choices are wrong. Cephalexin and clindamycin treat bacterial skin infections, but not HSV. Topical mupirocin is for superficial bacterial infection such as impetigo. Silver sulfadiazine is used for selected burns and does not treat herpes. High-yield takeaway. Herpetic Whitlow should not be incised and drained like a bacterial felon. Identify what antihypertensive should be added in a 70-year-old man with known coronary artery disease, prior myocardial infarction, and persistent blood pressure of 150/95 despite beta blocker therapy. Which of the following is the most appropriate additional pharmacotherapy for this patient? The correct answer is lisinopril. An ACE inhibitor is an appropriate blood pressure agent with important cardiovascular benefit in many patients with established coronary disease and prior MI. Why the other choices are wrong. Amlodipine can lower blood pressure, but does not provide the same post-MI renin-angiotensin system benefit as the best offered option. Clonidine is not preferred chronic first-line therapy because of CNS adverse effects and rebound hypertension. Hydrochlorothiazide is reasonable for hypertension, but is less compelling than ACE inhibition in this coronary context. No additional treatment is inappropriate because his blood pressure remains clearly above goal. High-yield takeaway. Match antihypertensive therapy to comorbid disease rather than treating the number in isolation. Select the immediate medication in a 57-year-old woman with an acute anterior STEMI, hypotension, crackles, and cardiovascular risk factors. Which of the following is the most appropriate pharmacotherapy at this time? The correct answer is aspirin. Chewed aspirin should be given promptly in acute STEMI unless there is a true contraindication while urgent reperfusion is being arranged. Why the other choices are wrong. Intramuscular morphine is not appropriate, and the IM route is particularly undesirable in a patient who will receive antithrombotic therapy. Diltiazem can worsen hypotension and is not the treatment for acute STEMI. Enoxaparin may be part of the antithrombotic strategy depending on reperfusion plan, but aspirin is the essential immediate choice among these options. Nitroglycerin is unsafe with her low blood pressure and could worsen hemodynamics. High-yield takeaway. STEMI means aspirin immediately plus urgent reperfusion. Avoid nitrates when hypotensive. Determine how to treat an adult with fever, tonsillar vesicles, and a child at home with hand, foot, and mouth disease. Which of the following is the most appropriate treatment for this patient? The correct answer is ibuprofen for supportive symptomatic treatment. This is a Coxsackie enterovirus syndrome, which is usually self-limited. Why the other choices are wrong. Acyclovir treats herpes viruses, not Coxsackie virus. Amoxicillin and amoxicillin clavulanate do not treat a viral illness, and the rapid streptococcal test is negative. Prednisone is not routine therapy for uncomplicated hand, foot, and mouth disease or herp angina, and may add immunosuppressive risk. High-yield takeaway. Viral hand, foot, and mouth disease gets hydration and analgesia, not antibiotics. Identify which long-term complication is most likely in a 4-month-old with glucosuria despite normal serum glucose, hypokalemia, metabolic acidosis, and hypophosphatemia from proximal tubular dysfunction. Which of the following is most likely to develop in this patient? The correct answer is osteomalacia. This is Fanconi syndrome, in which the proximal tubule wastes bicarbonate, phosphate, glucose, amino acids, and other solutes. Chronic phosphate wasting impairs bone mineralization. Why the other choices are wrong. Congestive heart failure is not a typical direct complication of Fanconi syndrome. Cushing syndrome results from excess glucocorticoids and is unrelated. Type 1 diabetes would cause hyperglycemia-associated glucosuria, whereas this infant has urine glucose with normal blood glucose. High-yield takeaway. Fanconi syndrome spills almost everything from the proximal tubule. Phosphate loss causes rickets in children or osteomalacia in adults. Identify what to add after initial fluid resuscitation in an 11-year-old with diabetic ketoacidosis, glucose near 700, ketones, and pH 7.16. In addition to volume expansion, which of the following is the most appropriate intervention at this time? The correct answer is a continuous intravenous infusion of short-acting insulin. After fluids and assessment of potassium, IV regular insulin suppresses ketogenesis and gradually corrects hyperglycemia and acidosis. Why the other choices are wrong. Sodium bicarbonate is not routinely indicated at a pH of 7.16 and can cause complications. Repeated IV insulin boluses produce less controlled correction than an infusion. Subcutaneous mixed short and intermediate acting insulin is inappropriate for severe DKA. Intermediate acting insulin alone cannot rapidly control active ketoacidosis. High-yield takeaway. DKA sequence is fluids, potassium assessment and replacement as needed, then continuous insulin. If potassium is severely low, replace potassium before insulin. Identify what to do when a child being treated for DKA suddenly develops headache, loss of consciousness, increased tone, and extensor posturing. Which of the following is the most appropriate next step in management? The correct answer is immediate mannitol therapy for cerebral edema. Neurologic deterioration during pediatric DKA treatment is cerebral edema until proven otherwise, and treatment should not be delayed for imaging. Why the other choices are wrong. Sodium bicarbonate does not treat cerebral edema and may worsen rapid osmotic shifts. CT may confirm edema, but waiting for imaging can delay life-saving therapy. EEG does not address the emergent intracranial pressure problem. Phosphoenitoin treats seizures, but does not treat the underlying cerebral edema. High-yield takeaway. Child with DKA who neurologically deteriorates gets immediate hyperosmolar treatment. Mannitol is the answer here, and hypertonic saline is also used clinically. Identify which future disease risk is greatest in a 25-year-old woman with polycystic ovary syndrome. The patient should be counseled that she is at greatest risk for acquiring which of the following conditions? The correct answer is diabetes mellitus. PCOS is strongly associated with insulin resistance and increased risk of impaired glucose tolerance and type 2 diabetes. Why the other choices are wrong. Hypertension can occur as part of the metabolic risk profile, but is not the strongest association among these choices. Hypothyroidism is not a defining long-term consequence of PCOS. Nephrotic syndrome is unrelated. Endometrial cancer risk is increased by chronic anovulatory unopposed estrogen, but the option says uterine cancer broadly. The most direct and common metabolic risk tested here is diabetes. High-yield takeaway. PCOS links hyperandrogenism, ovulatory dysfunction, and insulin resistance. Remember the diabetes and endometrial hyperplasia risks. Identify what to do with a 55-year-old woman who has known mitral regurgitation and has now developed orthopnea, an S3, and worsening symptoms suggesting severe hemodynamically important disease. Which of the following is the most appropriate next step in management? The correct answer is to evaluate her for valve replacement or definitive valve intervention. Once severe mitral regurgitation becomes symptomatic or causes ventricular consequences, simply escalating blood pressure medicines does not address the structural lesion. Why the other choices are wrong. Adding amlodipine may lower blood pressure, but does not correct severe regurgitation. Increasing hydrochlorothiazide and lisinopril may improve congestion or afterload, but cannot substitute for definitive evaluation when symptomatic severe valve disease is present. A healthy, low-sodium diet is beneficial, but insufficient. Starting exercise without addressing symptomatic structural heart disease is not the next step. High-yield takeaway. Symptomatic severe valve disease means think definitive valve intervention, not endless medication escalation. Determine how to counsel a pregnant woman on methadone maintenance who wants to breastfeed and has recently stopped cocaine and amphetamine use. Which of the following is the most appropriate response? The correct answer is to develop a plan that allows safe breast milk while accounting for which substances are currently being used. Methadone maintenance itself is generally compatible with breastfeeding, but active use of cocaine or amphetamines would create important safety concerns. Why the other choices are wrong. HIV risk alone does not mean she has HIV and is not a reason to prohibit breastfeeding. A past substance use history is not an automatic lifelong contraindication. Encouraging breastfeeding solely because she is on methadone ignores the need to address relapse and other drug exposures. Saying methadone, cocaine, and amphetamines do not enter breast milk in harmful amounts is false. Cocaine and non-prescribed stimulants can be dangerous to the infant. High-yield takeaway. Methadone treatment by itself does not preclude breastfeeding, but current non-prescribed substance exposure must be assessed and managed explicitly. Identify what to do next after thoracentesis reveals an exudative serosanguinous pleural effusion with negative culture and cytology. Which of the following is the most appropriate next step in management? The correct answer is CT of the chest. The fluid meets exudative criteria and remains unexplained, so cross-sectional imaging is needed to evaluate the pleura, lung parenchyma, mediastinum, and possible malignancy or other structural cause. Why the other choices are wrong. Bronchoscopy may be indicated later if imaging suggests an endobronchial lesion, but is not the next broad diagnostic step. Echocardiography is most useful when heart failure is suspected, but the fluid is exudative rather than a straightforward transudate. Furosemide treats volume overload transudative effusions and would not explain this fluid profile. Moxifloxacin is inappropriate without evidence of bacterial pneumonia or parapneumonic infection. High-yield takeaway. Light's criteria identify exudates. If an exudate remains unexplained, investigate the underlying pleural or pulmonary disease rather than treating it as simple heart failure. Determine how to reduce seizure recurrence in a 26-year-old man who likely had a generalized seizure after repeatedly staying awake all night to study and consuming very large amounts of caffeine. In addition to decreasing his caffeine intake, which of the following recommendations is most likely to prevent recurrent seizures in this patient? The correct answer is maintaining adequate sleep. Severe sleep deprivation is a well-known seizure precipitant, and removing the reversible trigger is the most relevant preventive intervention in this stem. Why the other choices are wrong. His modest alcohol intake is not the dominant precipitant described. Lisinopril does not explain the event and should not be stopped for this reason. Changing occupations is unnecessary when the modifiable problem is sleep deprivation. Tobacco cessation is important for long-term health, but is not the most direct intervention to prevent another provoked seizure. High-yield takeaway. Not every first seizure means lifelong anti-seizure therapy. First ask whether a reversible provoking factor, such as sleep deprivation, intoxication, withdrawal, or metabolic derangement, is present. Determine how to manage a wrist injury after a fall when the X-ray shows a scaphoid fracture. Which of the following is the most appropriate management? The correct answer is a cast that incorporates the thumb or thumb spica immobilization. Scaphoid fractures require immobilization because their retrograde blood supply puts the proximal segment at risk for non-union and avascular necrosis. Why the other choices are wrong. An elastic bandage does not adequately immobilize the scaphoid. A simple wrist splint that does not immobilize the thumb is insufficient for the fracture shown. Aspirin with unrestricted hand use risks displacement and impaired healing. Occupational therapy is not the immediate treatment for an acute fracture. High-yield takeaway. Snuff box or scaphoid injury means thumb spica even when an early radiograph is negative, but clinical suspicion remains high. Select definitive management of a 62-year-old man in shock with sudden crushing chest and back pain and an ascending aortic catastrophe involving the aortic root. Which of the following is the most appropriate next step in management? The correct answer is emergency replacement of the aortic root. This is a Stanford Type A aortic dissection involving the ascending aorta and producing hemodynamic instability, which requires urgent surgery. Why the other choices are wrong. Coronary angiography delays definitive treatment and is not the primary diagnostic or therapeutic step for known Type A dissection. Head CT does not address the cause of shock. Norepinephrine may temporarily support perfusion, but does not treat the dissection, and excessive pressure can worsen shear stress. An intra-aortic balloon pump is contraindicated in significant aortic dissection because it can propagate the dissection or worsen aortic regurgitation. High-yield takeaway. Type A means ascending and act surgically. Type B often starts with medical impulse control unless complicated. Identify what follow-up is needed after a 20-year-old has unprotected sex 1 week ago, presents with urethritis, and has a negative rapid HIV antibody test. Assuming that the patient's symptoms improve with the prescribed pharmacotherapy, which of the following is the most appropriate follow-up plan? The correct answer is repeat HIV serologic testing in 3 months, which is the window period answer in this item. A test obtained only 1 week after exposure can be falsely negative because detectable antibody may not yet have developed. Why the other choices are wrong. He is an adult, so parental consultation is unnecessary and would violate confidentiality. A 1-week office follow-up does not solve the HIV window period issue. No follow-up is inappropriate because the initial test was obtained too soon to exclude infection reliably. High-yield takeaway. A very early negative HIV test does not exclude infection. In current practice, repeat timing depends on the assay used. The exam's antibody-only test requires later repeat testing. Identify which medication should not be newly started in a 65-year-old man who is actively volume overloaded with decompensated systolic heart failure. Administration of which of the following is contraindicated in this patient? The correct answer is metoprolol. Evidence-based beta blockers are crucial long-term therapy for stable HFrEF, but new initiation or aggressive titration should wait until acute congestion and decompensation are controlled. Why the other choices are wrong. Furosemide is appropriate for relieving acute volume overload. Lisinopril is foundational HFrEF therapy when blood pressure, renal function, and potassium permit. Spironolactone is also an evidence-based therapy in eligible HFrEF patients, although potassium and renal function must be monitored. Digoxin may be used in selected patients and is not categorically contraindicated by congestion itself. High-yield takeaway. Beta blockers are excellent chronic HFrEF drugs, but timing matters. Wet and decompensated means stabilize first, then build guideline-directed therapy. Identify which electrolyte abnormality a malnourished man with alcohol withdrawal is at greatest risk of developing after nutritional support is initiated. During this patient's hospital stay, he is at greatest risk for developing which of the following? The correct answer is hypophosphatemia from refeeding syndrome. The insulin surge that follows carbohydrate delivery drives phosphate, potassium, and magnesium into cells, with phosphate depletion being the classic hallmark. Why the other choices are wrong. Hypocalcemia can occur in complex malnutrition, but is not the signature refeeding abnormality. Hypokalemia can occur and must be monitored, but phosphate depletion is the classic and potentially profound change. Hyponatremia is not the defining electrolyte shift. High-yield takeaway. Refeeding feeds phosphate into cells. Severe hypophosphatemia can cause respiratory weakness, arrhythmias, seizures, rhabdomyolysis, and heart failure. Determine how to treat a 21-year-old after an unknown analgesic overdose who has tinnitus, tachypnea, and a mixed acid-base disorder characteristic of salicylate toxicity. Which of the following is the most appropriate next step in management? The correct answer is intravenous sodium bicarbonate. Alkalinizing the serum and urine keeps salicylate in its ionized form, decreases CNS penetration, and enhances renal elimination. Why the other choices are wrong. Lipid emulsion is reserved for selected severe lipophilic drug toxicities, such as local anesthetic systemic toxicity. N-acetylcysteine is the antidote for acetaminophen toxicity. Intubation can be dangerous in salicylate poisoning because even a brief loss of the patient's compensatory hyperventilation can rapidly worsen acidemia and CNS salicylate entry. It is reserved for unavoidable airway failure with careful ventilation. Supportive care alone is insufficient in significant toxicity. High-yield takeaway. Salicylates cause early respiratory alkalosis plus anion gap metabolic acidosis. Bicarbonate is a core treatment. Identify what controller therapy to add in a 24-year-old with asthma who now needs albuterol twice daily, has frequent nighttime cough, and has an FEV1 of 70% predicted. Which of the following is the most appropriate next step in pharmacotherapy? The correct answer is inhaled fluticasone. Her symptoms indicate persistent asthma requiring inhaled corticosteroid-containing controller therapy. Why the other choices are wrong. Tiotropium is an add-on option in selected patients with more difficult asthma, not the first controller here. Azithromycin does not treat uncomplicated persistent asthma. Montelukast can be used in selected situations, but is generally less effective than inhaled corticosteroid as first-line anti-inflammatory control. Simply scheduling more albuterol treats bronchospasm without treating airway inflammation. A short prednisone burst is for a significant acute exacerbation, which she does not have. High-yield takeaway. Frequent symptoms or nighttime awakenings mean the patient needs anti-inflammatory controller therapy, not just more rescue bronchodilator. Identify which condition a 9-year-old with multiple motor tics, vocal tics, and attention problems is especially likely to develop. Based on these findings, this patient is most likely to develop which of the following? The correct answer is obsessive-compulsive disorder. Tourette syndrome is strongly associated with OCD and ADHD. Why the other choices are wrong? Wilson disease causes hepatic and neurologic abnormalities such as dystonia or tremor, not a typical chronic tic syndrome. Huntington disease is an autosomal dominant neurodegenerative disorder presenting later with chorea and psychiatric changes. Intellectual disability is not a defining comorbidity of Tourette syndrome. Seizures involve abnormal cortical electrical activity and usually alter awareness or have a different stereotyped motor pattern. The observed tics occur without altered consciousness. High-yield takeaway. Tourette travels with OCD and ADHD. Identify which complication is most likely in a 14-year-old with weight loss, chronic abdominal pain, diarrhea, oral ulcers, right lower quadrant fullness, and growth impairment from Crohn's disease. Which of the following is the most likely complication of this patient's condition? The correct answer is an anal fistula. Crohn inflammation is transmural, so fistulas, abscesses, strictures, and perianal disease are characteristic complications. Why the other choices are wrong? Colorectal cancer risk rises after many years of extensive inflammatory bowel disease, not after this short presentation. Diabetes mellitus is not a typical Crohn complication. Progressive pulmonary failure is unrelated. Toxic megacolon is classically associated more strongly with severe ulcerative colitis, although it can rarely occur in Crohn colitis. High-yield takeaway. Crohn goes through the wall, so think fistulas and strictures. Determine how to treat a 65-year-old man with painful bowed tibia, cortical thickening, and intramedullary sclerosis from Paget disease of bone. Which of the following is the most appropriate pharmacotherapy? The correct answer is oral alendronate. Bisphosphonates suppress excessive osteoclast-mediated bone turnover and are first-line therapy for symptomatic Paget disease. Why the other choices are wrong? Calcitonin can reduce bone turnover, but is less effective and is generally an alternative when bisphosphonates cannot be used. Mithramycin is an older toxic therapy and is not preferred. Naproxen may reduce pain, but does not treat the underlying high turnover bone disorder. High-yield takeaway. Paget disease is disorganized, high turnover bone remodeling. Symptomatic disease is treated with a bisphosphonate. Select initial treatment of a gastric ulcer biopsy showing CD19 and CD20 positive lymphoid tissue consistent with gastric MALT lymphoma. In addition to prescribing omeprazole therapy, which of the following is the most appropriate initial treatment? The correct answer in the item is H. pylori eradication using clarithromycin and amoxicillin along with acid suppression. Early gastric MALT lymphoma is strongly linked to Helicobacter pylori and can regress after eradication of the organism. Why the other choices are wrong? Cyclophosphamide plus metronidazole is not a standard H. pylori eradication or first-line localized MALT regimen. Radiation is effective for selected persistent localized disease, but generally follows failure or absence of an H. pylori-driven process. Rituximab can be used for selected persistent or disseminated disease, but is not the first step in uncomplicated H. pylori-associated disease. Surgical resection is not routinely required. High-yield takeaway. Gastric MALT lymphoma equals test for and eradicate H. pylori. Current antibiotic selection should follow local resistance guidance. The exam is testing the eradication principle. The long-term outcome of a previously healthy 21-year-old with a febrile illness followed by acute dilated cardiomyopathy and reduced ejection fraction consistent with viral myocarditis. Which of the following is the most likely long-term outcome for this patient? The correct answer is complete recovery. Many young patients with acute viral myocarditis experience substantial or complete recovery of ventricular function as the inflammatory injury resolves. Why the other choices are wrong. Mild, isolated diastolic dysfunction is not the expected specific endpoint of an acute systolic myocarditis syndrome. Pulmonary embolism is not a predictable long-term consequence. Recurrent pericarditis is a different inflammatory syndrome. Immediate progression to transplant-level severe systolic failure can occur in fulminant cases, but is not the most likely outcome in this otherwise stable young patient. High-yield takeaway. A low ejection fraction from a reversible inflammatory insult does not necessarily represent permanent cardiomyopathy. Determine whether a healthy 25-year-old man who has sex with men should receive HPV vaccination. Which of the following is the most appropriate next step in management? The correct answer is to administer the HPV vaccine. Routine catch-up vaccination is recommended through age 26, regardless of current relationship status or prior sexual activity. Why the other choices are wrong. HPV serology is not used to decide whether vaccination is indicated. Anal pap screening is a separate issue and is not a substitute for vaccination in this healthy 25-year-old. Motivational interviewing toward abstinence does not prevent prior or future HPV exposure as reliably as recommended vaccination and is not the appropriate medical response. High-yield takeaway. Through age 26, catch-up HPV vaccination if not adequately vaccinated. Select the next diagnostic step in a 36-year-old with acute pancreatitis, mildly elevated bilirubin and alkaline phosphatase, and no heavy alcohol use. In addition to beginning intravenous fluids, which of the following is the most appropriate next step in management? The correct answer is right upper quadrant ultrasonography. The laboratory pattern raises concern for gallstone pancreatitis, and ultrasound evaluates the gallbladder for stones and biliary dilation. Why the other choices are wrong. Contrast CT is not routinely required immediately when acute pancreatitis is clinically established, and the scenario specifically points toward a biliary cause. Triglycerides of 275 are far below the typical levels causing hypertriglyceridemic pancreatitis, so fenofibrate is not the next step. Prophylactic antibiotics, such as imipenem, are not indicated in uncomplicated pancreatitis. Insulin therapy is used for severe hypertriglyceridemic pancreatitis or hyperglycemic emergencies, neither of which is present. High-yield takeaway. Pancreatitis plus cholestatic clues means look for gallstones with right upper quadrant ultrasound. Identify what inheritance pattern can be concluded from a pedigree of early onset familial visual loss when the displayed family data do not uniquely distinguish among genetic mechanisms. Which of the following is the most appropriate conclusion about the inheritance of this disorder? The correct answer is that the inheritance pattern is indeterminate. The pedigree does not provide enough information to confidently assign an autosomal or X-linked pattern. Why the other choices are wrong. Autosomal dominant, X-linked dominant, and X-linked recessive inheritance each require pedigree features that are not definitively established. Chromosomal aneuploidy would not typically present as a multi-generational, isolated, early adult visual loss trait. High-yield takeaway. Do not force a Mendelian pattern when the pedigree lacks enough informative relationships. Identify which finding most strongly predicts poor prognosis in a 46-year-old woman with autosomal dominant polycystic kidney disease. Which of the following findings most strongly indicates a poor prognosis in this patient? The correct answer is impaired kidney function reflected by elevated creatinine. Officials' loss of renal function is a direct marker of disease severity and progression risk. Why the other choices are wrong. BMI influences general metabolic risk, but is less directly prognostic for ADPKD progression than renal function. Counting cysts alone is less informative than total kidney burden and actual renal performance. A normal copeptin concentration does not indicate poor prognosis here. LDL concentration affects cardiovascular risk, but is not the strongest marker of kidney disease progression. Urine sodium is not the dominant prognostic variable. High-yield takeaway. When asked for prognosis, favor the variable most directly tied to the organ's functional decline. Identify which feature in a 32-year-old with perennial allergic rhinitis most strongly predicts progression to a more serious respiratory condition. Which of the following factors in this patient's history most strongly predicts development of a more serious condition? The correct answer is associated shortness of breath and wheezing. These symptoms indicate lower airway involvement and strongly suggest or predict asthma rather than isolated upper airway allergic disease. Why the other choices are wrong. A family history of similar rhinitis supports atopy, but does not indicate lower airway disease as directly. Loss of smell can occur with chronic rhinitis or nasal polyps. Perennial symptoms indicate ongoing exposure, but do not by themselves predict asthma as strongly as actual wheezing and dyspnea. High-yield takeaway. Allergic rhinitis plus episodic wheeze means think one airway and evaluate for asthma. Determine how to treat persistent wheezing and shortness of breath after allergen control measures in a patient with allergic rhinitis and probable asthma. Which of the following is the most appropriate pharmacotherapy at this time? The correct answer is inhaled fluticasone. Persistent lower airway symptoms require inhaled corticosteroid therapy to control airway inflammation. Why the other choices are wrong. Nasal cromolyn treats allergic nasal symptoms and does not adequately control lower airway asthma. Nasal oxymetazoline is a topical decongestant that can cause rebound congestion with prolonged use and does not treat asthma. Oral fexofenadine can improve allergic rhinitis, but is not an asthma controller. High-yield takeaway. Treat the organ causing the symptoms. Lower airway wheezing needs asthma therapy, not just more rhinitis medication. Identify which antibiotic regimen is safest for community-acquired pneumonia in a woman with myasthenia gravis. Which of the following is the most appropriate pharmacotherapy for this patient at this time? The correct answer is ceftriaxone plus doxycycline. This provides appropriate inpatient community-acquired pneumonia coverage while avoiding several antibiotic classes known to worsen neuromuscular transmission. Why the other choices are wrong. Amoxicillin clavulanate alone lacks adequate atypical coverage for this hospitalized presentation. Azithromycin can exacerbate myasthenia gravis. Cefepime plus tobramycin is unnecessarily broad, and aminoglycosides can significantly worsen neuromuscular transmission. Levofloxacin can exacerbate myasthenia and carries a specific warning. Trimethoprim sulfamethoxazole is not an appropriate standard regimen for this pneumonia syndrome. High-yield takeaway. Myasthenia can worsen with macrolides, aminoglycosides, fluoroquinolones, and magnesium. Choose alternatives when possible. Determine how to respond when a friend reports that a patient receiving chronic oxycodone may be selling the medication and the patient is requesting a dose increase. Which of the following is the most appropriate next step? The correct answer is to order a random urine test for oxycodone. The concern should trigger objective assessment of adherence and possible diversion rather than immediate accusation or punishment. Why the other choices are wrong. Abruptly discontinuing oxycodone based only on a third-party allegation is premature. Notifying police breaches the therapeutic relationship and is not justified by unverified information. A methadone clinic is for opioid use disorder treatment and is not indicated simply because diversion is suspected. Switching to another opioid does not investigate the concern and could perpetuate the same problem. High-yield takeaway. Suspected diversion means verify objectively and reassess the treatment agreement and safety before making major changes. Identify which lifestyle intervention is most important for preventing coronary artery disease in a 36-year-old woman with high cholesterol, a strong family history, and a 20-pack year active smoking history. Institution of which of the following is the most essential step in the prevention of CAD in this patient? The correct answer is smoking cessation. Among the listed modifiable factors, active tobacco use is the highest impact cardiovascular risk exposure. Why the other choices are wrong. Stress reduction may improve well-being, but has less established cardiovascular impact than stopping smoking. More exercise is valuable, but does not outweigh the risk from continued tobacco use. Weight loss is helpful for overweight patients, but is not the single most essential intervention here. A strict, low-fat diet is less important than smoking cessation, and modern dietary recommendations focus on overall dietary pattern rather than simply minimizing all fat. High-yield takeaway. When an active smoker asks for the single biggest modifiable cardiovascular intervention, smoking cessation often wins. Identify what additional medication is needed after lifestyle counseling and metformin in a newly diagnosed 48-year-old with type 2 diabetes, normal blood pressure, and no albuminuria. In addition to metformin, which of the following is the most appropriate pharmacotherapy? The correct answer is no additional pharmacotherapy among the listed choices. She does not have hypertension, albuminuria, or another stated indication for an ACE inhibitor, beta blocker, or thiazide, and aspirin is not automatically prescribed to every patient with diabetes for primary prevention. Why the other choices are wrong. Aspirin for primary prevention requires individualized cardiovascular risk and bleeding risk assessment and is not routine solely because of diabetes. Chlorthalidone is unnecessary without hypertension. Lisinopril is not indicated solely for renal protection in a normotensive patient with normal urine albumin. Metoprolol also has no current indication. High-yield takeaway. Do not prescribe a disease label checklist. Treat actual comorbid indications. Select the immediate next medication in an untreated hyperthyroid 49-year-old with fever, tremor, goiter, and atrial fibrillation with a ventricular rate near 170. Which of the following is the most appropriate next step? The correct answer is intravenous propranolol. Beta blockade rapidly controls the severe adrenergic manifestations and ventricular rate. Propranolol also decreases peripheral conversion of T4 to T3 at higher doses. Why the other choices are wrong. Electrical cardioversion is reserved for hemodynamic instability attributable to the arrhythmia and does not treat the underlying thyrotoxicosis. She is maintaining blood pressure after fluids. Dexamethasone is part of thyroid storm therapy, but is not the fastest offered intervention for severe adrenergic symptoms and rapid ventricular response. Diltiazem can control rate when beta blockers are contraindicated, but does not provide the same thyrotoxicosis benefit. Potassium iodide blocks hormone release, but should be given only after a thionamide has blocked new hormone synthesis. High-yield takeaway. Severe thyrotoxicosis is treated by controlling adrenergic effects, blocking hormone synthesis, then blocking hormone release, with glucocorticoids and supportive care as indicated. Identify what behavioral advice to give a 25-year-old with temporomandibular joint pain, limited mouth opening, clicking, and frequent gum chewing. The patient should be advised to do which of the following? The correct answer is to avoid chewing gum and hard or chewy foods. Initial TMJ management is conservative and aims to reduce repetitive mechanical stress. Why the other choices are wrong? Orthodontic consultation is not the first treatment for an acute, uncomplicated TMJ pain syndrome. Cradling a phone between the shoulder and jaw increases musculoskeletal strain. Repeatedly opening the jaw widely can aggravate the joint. Oxycodone is excessive for initial management and creates unnecessary opioid risk. High-yield takeaway. TMJ pain starts with jaw rest, soft foods, avoidance of gum, and non-opioid conservative measures. Determine how to help a new mother who wants to breastfeed but expects to return to an assembly line job in 4 weeks with limited breaks. Which of the following is the most appropriate recommendation? The correct answer is to encourage breastfeeding now and help her discuss a pumping schedule with her employer. This supports her stated health goal while addressing the practical barrier directly. Why the other choices are wrong? Telling her to find a new job is unrealistic and not patient-centered. Advising against breastfeeding abandons her preference without a medical reason. Telling her to focus on what is best for the baby is judgmental and fails to solve the work barrier. Combination feeding can be reasonable by preference, but it should not be imposed simply because she plans to return to work, when pumping may allow continued breastfeeding. High-yield takeaway. Support a feasible patient goal and solve the barrier rather than replacing the goal. Identify which complication is associated with a lateral medullary stroke in a 63-year-old with dysphagia, hoarseness, ipsilateral facial symptoms, Horner findings, and ipsilateral ataxia. Based on these findings, this patient is most likely to develop which of the following? The correct answer is sleep-related hypoventilation. The medulla contains respiratory control networks, and lateral medullary injury can disrupt automatic breathing, particularly during sleep. Why the other choices are wrong? Achalasia and gastroparesis reflect enteric or autonomic gastrointestinal disorders and are not the expected brainstem complication. Angle closure glaucoma causes acute, painful red eye with elevated intraocular pressure, not this neurologic syndrome. Orthostatic hypertension is not a classic consequence. Third-degree AV block is a cardiac conduction disorder and is not the expected complication of lateral medullary infarction. High-yield takeaway. Lateral medullary syndrome gives dysphagia and hoarseness, ipsilateral facial sensory loss and Horner syndrome, contralateral body pain temperature loss, and ipsilateral ataxia. Select the most important initial treatment of a stage 2 sacral pressure ulcer in an immobile 84-year-old nursing home resident. Which of the following treatment modalities is most likely to have the greatest effect on wound healing in this patient? The correct answer is pressure relief. The wound cannot heal if repetitive pressure and shear continue to compromise tissue perfusion. Why the other choices are wrong? A hypercaloric diet may be useful if nutritional deficiency is present, but does not remove the primary cause. Silver sulfadiazine is not routine therapy for an uncomplicated stage 2 pressure injury. Debridement is used for devitalized or necrotic tissue. A superficial stage 2 ulcer does not automatically require it. High-yield takeaway. Pressure ulcer means remove the pressure first. Identify which antibiotic to use for severe lactational mastitis or a developing breast abscess that has worsened despite cephalexin in a recently hospitalized postpartum woman. Which of the following is the most appropriate pharmacotherapy at this time? The correct answer is intravenous vancomycin. Failure of beta-lactam therapy plus healthcare exposure raises concern for MRSA, and she is ill enough to require inpatient intravenous coverage while aspiration or drainage is arranged. Why the other choices are wrong? Ampicillin, sulbactam, and cefazolin do not reliably cover MRSA. Piperacillin tazobactam is broad, but also lacks dependable MRSA coverage and provides unnecessary gram-negative breadth for this syndrome. Oral dicloxacillin is appropriate for uncomplicated methicillin-sensitive staphylococcal mastitis, but is inadequate after treatment failure with concern for resistant infection. High-yield takeaway. A true abscess needs source control as well as appropriate antibiotics. Pus needs drainage. Determine how to manage an older woman with months of thigh pain, subtrochanteric cortical thickening, marrow edema, and lateral cortical discontinuity representing a high-risk incomplete femoral stress fracture. Which of the following is the most appropriate next step in management? The correct answer is surgical fixation. A symptomatic incomplete subtrochanteric fracture with cortical disruption has substantial risk of progressing to a complete displaced fracture and is often prophylactically stabilized. Why the other choices are wrong? Bisphosphonates suppress bone remodeling and do not heal an impending high-risk fracture. Calcitonin is not appropriate fracture stabilization. A brace or cast does not reliably protect the subtrochanteric femur from the large forces of weight-bearing. Intra-articular dexamethasone targets joint inflammation, not a femoral cortical fracture. Observation alone risks catastrophic completion and displacement. High-yield takeaway. High-risk incomplete femoral fracture plus pain and cortical break means fix it before it becomes complete. Identify which major complication is likely if a 40-year-old woman with untreated Graves' disease remains severely hyperthyroid. Without treatment, which of the following is most likely to develop in this patient? The correct answer is congestive heart failure. Persistent tachycardia, increased contractility, expanded blood volume, and high metabolic demand can produce high-output heart failure, atrial arrhythmias, and eventually tachycardia-mediated cardiomyopathy. Why the other choices are wrong? Chronic kidney disease is not a characteristic direct consequence of untreated Graves' disease. Fibromyalgia is unrelated. Graves' ophthalmopathy is associated with thyroid autoimmunity, but glaucoma is not the expected untreated systemic complication. Multiple sclerosis is an unrelated demyelinating disorder. High-yield takeaway. Too much thyroid makes the heart run too hot. Think atrial fibrillation and heart failure. Identify which medication must be stopped in a 68-year-old on haloperidol who develops fever, lead pipe rigidity, and an elevated creatine kinase. At this time, it is most important to discontinue which of the following medications? The correct answer is haloperidol. The syndrome is neuroleptic malignant syndrome from dopamine D2 receptor blockade, and the first step is immediate discontinuation of the offending antipsychotic plus aggressive supportive care. Why the other choices are wrong? Benztropine is not the cause of the lead pipe rigidity and hyperthermic syndrome. Ciprofloxacin can cause many adverse effects but does not produce classic NMS. Lorazepam is often useful for agitation and can be part of supportive management rather than the trigger. Methylprednisolone does not cause NMS. High-yield takeaway. NMS equals fever, encephalopathy, autonomic instability, elevated CK, and lead pipe rigidity after dopamine blockade. Stop the antipsychotic. Serotonin syndrome instead favors hyperreflexia and clonus.